Good morning from Stockholm and welcome to this digital conference on good and equal health in the Nordics. My name is Morten Hillegaard and I have the privilege of guiding us through this important gathering where we come together to explore vital aspects of good and equal health in the Nordic countries. Today's conference is organized by the Swedish Presidency of the Nordic Council of Ministers, to whom public health is a main theme of the entire presidency for this year 2024. We are more than 330 participants gathered here today from all over the Nordic countries and Nordic region, and actually also have participants with us from both the USA, from Turkey, from the Baltic countries, and we of course welcome you all here today. Very often at public health conferences, the main issues are smoking, alcohol, as they are known to be the biggest killers and the biggest risk factors with a very big impact on public health. Today we'll delve into three other interconnected themes that are also very central to basically ensure public health in both the Nordic countries and all over the world. But these are themes that attract far less attention in the public health work in general. It's meaningful and active leisure, it's screen time and digital media use, and it's loneliness and social isolation. These are some of the newer risk factors that we need to more knowledge about and need to find new ways to address to ensure and achieve good and equal health for all. The idea behind this conference is that both the challenges and the solutions resonate across the Nordic countries. So by pooling our collective knowledge and expertise, we hope that we can chart the course towards a healthier, more equitable future for all in the Nordic region. I'll get back to some more practical, detailed information about today's conference and the program. But first, I think we should welcome the Swedish Minister for Social Affairs and Public Health, Jakob Forssmed, who will be giving the opening speech of this conference.
Good morning to all of you. It is with great pleasure I welcome you all to this important conference on good and equal health in the Nordics, focusing on promoting health and well-being. I am glad to have this opportunity under the Swedish Presidency of the Nordic Council of Ministers to bring together experts from across the Nordic region to present and discuss different perspectives on some of the biggest public health challenges we face today. As the Minister responsible for health and well-being of the Swedish population, I am deeply committed to ensuring good and equal health outcomes for all members of our population. But we know this is not the case today. We know people have different opportunities to live healthy and long lives. These differences are often driven by multiple determinants of health that interact on different levels, such as social and economic conditions, as well as access to community resources and social relations. To address these different health determinants, actions are needed from governments and the public sector. But we also need to work together, because health is not only an individual matter. Health is something that we build together, as a society, as a community. And this is what unites the topics of today's conference: strengthening community and social relations, creating environments that empower and support people's opportunities for health and well-being. Starting with our children and youth, they need to be prioritized in public health efforts. All children and adolescents should have access to active and meaningful leisure time in community with others. It could be through, for an example, sports, arts, or music. This is important here and now, and it lays the foundation for a good health later in life. A special attention needs to be directed to those children most in need. We need to make sure there are opportunities for all children, but something that worries me and that will have an impact on these opportunities is this. There are, of course, positive aspects of this entrance in our lives. It can offer social connections, knowledge, and information. But I am deeply concerned about the increase in use and the time we spend on the screens and digital media, especially children and young people. The screen seems to enter every corner of our lives and seems to push other things aside, like taking part in physical activities, doing homework, or sleep, all very important aspects for health. And we know too little about how this is affecting us. We need to increase our knowledge on this, of course. Another major public health concern of mine is loneliness and social isolation. It has such a negative impact on our physical and mental health, not to mention the human suffering. For me, the awareness of the problem raised when I saw the consequences of loneliness in society. Before I was appointed as minister, I was a member of parliament, working mostly with economic and financial matters, and it became very clear that lack of social connection, as well as loneliness, have costs that go well beyond the individual dimension. Loneliness is a complex, cross-sectorial issue. It requires broad efforts in several policy areas, and we need to gather different actors, because together we can make the change. And now that we have experts from all over the Nordics gathered, and before I finish, I have 3 questions for you to bring with you into the conference. How do we get all children involved in leisure and community activities? Also, those who, for various reasons, think it is impossible or a big step to join a club or an association. My second question is, how can we create a constructive dialogue about how society can support children and young people to have a healthy relationship with digital media? We need a dialogue where different perspectives and different measures are seriously considered. My third and final question is, what role society can play when it comes to combat loneliness and social isolation? What is our society's most important contribution for reducing loneliness? I'm looking forward to taking part of your inputs and thoughts on these issues, and I'm hopeful that together and by sharing insights from the current work in our Nordic countries, we will help contribute and develop our collective efforts and identity, promising initiatives for future actions. I am confident that this conference will serve as a platform for fruitful discussions, valuable insights, and meaningful collaborations. By working together, we can continue to advance our shared goals of promoting good health and well-being for all people in our societies. Thank you, and I wish you all a very productive and inspiring conference.
As you can hear from the Minister's opening address, the conference 3 themes are determined by and linked to the Swedish Presidency of the Nordic Council of Ministers. And this means that there is also a political will and attention to the insight and ideas that are gathered and will be showed and shared here today. And just to repeat the 3 main questions, you can see them on the screen here as well, the questions that we seek answers to throughout the day. How do we get all children involved in leisure and community activities? How can we create a constructive dialogue about how society can support children and young people to have a healthy relationship with digital media? And how can society play a role when it comes to combat loneliness and social isolation? The questions highlights how the conference is framed. This is also about a broader concept of health, where health is a state of physical, mental, and social well-being, and not merely the absence of disease. And where health is both the individual lifestyle, of course, living conditions, but also opportunities that society provide for healthy living for us all. The 3 questions will guide today's program and the themes that will be covered throughout the day. First, this morning, we'll get a background on the problems and the challenges behind the themes. And then, after a short break, we will address the first theme, a meaningful and active leisure for children and youth. Then, after lunch, we will address the second and third theme, screen time and digital media use among children and youth, and then the prevention of loneliness and social isolation. In all parts of the program, you'll be introduced to different Nordic models from different Nordic countries that try to address these different challenges in different ways with respect to the different cultural background, but also drawing on some of the common Nordic features of our societies, so that we can learn how we can share and improve solutions in all the countries. But before we get started and move into today's program, let's have a look at who's attending here today. I'll ask you to grab your phone or another device that is connected and go to menti.com and then use the code here on the screen to go in and pin your location. You can also use the QR code here. Just take the camera on your phone and take a picture of the code, and you'll be guided to the Menti website. First here, I would ask you to pin your current location on the map showed at Menti. In this way, we'll get a common picture of where we all are. If your location is not fully visible in this map that is focused around Northern Europe, then please just put it in one of the corners so we get an idea of where we are. Now I start to get a picture. Definitely quite a few people in Stockholm, quite a few in Copenhagen, Sweden, Finland, the Baltic countries, Iceland, the Faroe Island, and both somewhere in the northeast, might be Finland or even further north, southeast. That might definitely be Turkey, as I mentioned before. Northwest might be the States. So we get a good picture. Thank you very much for sharing this. It shows us that at least the basic idea of basically coming together across the Nordic regions, but also across other countries that want to both share and learn from some of the experiences here are more than welcome. If we can just change to the next slide at Menti, I have one question that I would like to ask you as well. Again, just to get us started, please help me to just raise what you see as the biggest public health challenge in your country today. Great. A lot of things coming in. From obesity, stress, mental health, social inequity, non-communicable diseases, alcohol, junk food. Very many different issues. Mental health seems to be popping up as one big theme that we will definitely be covering. The idea behind this basically is to show that we have many public health issues that we need to address in all of our societies. And I'm quite confident that we will touch upon several of these today. Some of them we will not, as mentioned before. Some of the more well-known and traditional risk factors we'll look less on. And then we'll have more focused on some of the newer risk factors, physical activity, social connectedness, screen, stress, and mental health as well. Thank you very much for sharing this. As said, I'm sure we're going to touch upon many of the themes here today. Throughout the conference, I will ask you and I encourage you to actually engage as well and share your insights and thoughts with your fellow attendees at the conference. You can do that in the Zoom chat. The chat will be moderated all day by Anna Ranninen from the Nordic Welfare Centre, who will also share useful links and other things, both from the presentations, but also practical comments that are related to today's program. So please feel free to use the chat as well and share both questions and insights. Good, let's get started. First, it's my pleasure to introduce our first speaker here today, Karin Tegmark-Wisell. Karin is the Director General at the Public Health Agency here in Sweden. And today, Karin will help us set the scene and give us an introduction to the relevance of today's three themes. So welcome, Karin.
Thank you very much.
The screen is yours.
Thank you. Today, as you have heard, we will talk about three major contemporary issues. Different but interconnected in the way we may go about counteracting the negative consequences and in the way we all need to contribute. Meaningful leisure time is important for health and has been quoted by the WHO in the Ottawa Charter for Health Promotion. Leisure time should be seen as a source of health improvement and important for adolescents' ability to cope with the demands of everyday life and strive for a meaningful and balanced life. And it is well established throughout the life cycle that meaningful leisure time can have a positive impact on mental health through the establishment of social relationships. It can reduce stress and strengthening identity, creativity, connection, harmony, and empowerment. This is a recent study performed by the Swedish Agency for Youth and Civil Society. As you can see, approximately 2/3 of youth in Sweden engage in unorganized physical activity. And there's no difference between the gender. However, not shown in this graph, girls with foreign background to a lower extent. 1/3 is engaged on a weekly basis in some kind of cultural activity, girls to a higher extent than boys, and when it comes to reading books, youth with a foreign background to a higher extent than those without. The same study shows participation in physical activity is relatively stable over time. This series shows the proportions since 2007, and you can see a slight decrease both for boys and girls in organized physical activity since the start of the first decades of the 20th. The Swedish national target for physical activity for children and youth is 1 hour per day with moderate to intense activity. However, only 1 out of 10 Swedish girls aged 15 are physically active at least 1 hour per day. And not shown in this graph, the corresponding proportion among 15-year-old boys is 1 in 5, and there's no significant change over time. According to the World Health Organization, too much recreational sedentary screen time, sitting still and not involving work or study, is considered a risk factor for both physical and mental health. The relationship between the use of digital media and health is complex, but too much screen time can affect important aspects of health, such as sleeping habits, physical activity, and social interactions. Many Swedish youth find digital media addictive. As you can see in these graphs showing time spent with the smartphone in percent, where 1 in 3 9 to 12-year-olds and every second 13 to 18-year-old report spending too much time with their smartphone. The same study, where the proportion who feel their media use lead them not doing what they should, is assessed. 52% of 17 to 18-year-olds assess that use of digital media lead them not doing what they should do. Not shown in this graph, the number was even higher among girls, who reported 59%. In the slide is also included a quotation from a girl in year 2 of upper secondary school. If we want to decrease the negative effects of digital media in young ages, a solution to break the norm that you need to live your social life digitally. To do that, activities for children must be organized by adults. Social connections are important for health. And another quotation from the World Health Organization Commission on Social Connection. Across all ages and religions, loneliness and social isolation have serious impact on our physical and mental health and the well-being of our communities and societies. And we know from research studies that social isolation and loneliness may lead to increase of early death, is linked to anxiety, depression, suicide, and dementia, and can increase risk of cardiovascular disease and stroke, and have a negative impact on entire communities and societies. As you can see in this graph, loneliness is commonly reported in adults, and the rate is highest among the youngest and the oldest age groups. The sex difference is most pronounced in the older age groups. Most adults report milder form of loneliness, but about 3% of the population experience severe forms of loneliness. Not shown in this graph, loneliness is also more common among people who are unemployed, on long-term sick leave, and among people with physical, mental, and intellectual disabilities, something that Hillevi Busch will come back to later in her presentation. What might be even more concerning, this slide shows that 1 of 4 Swedish girls aged 15 experience loneliness often or always. The numbers are slightly lower in the younger age groups. That is, loneliness in Swedish school children increase with age. Girls in lilac in this slide report loneliness to a higher extent than boys. Limited time for social activities may increase feeling loneliness. Loneliness is associated with poorer mental health and physical health. The figure illustrates this association. As seen, mental distress is several times higher among people who report loneliness in green compared to those who do not in lilac. And the same pattern is seen for suicide thoughts that is on the right-hand side on the slide. Loneliness can lead to poorer mental health, but poor mental health may also contribute to increased loneliness. The Swedish Public Health Framework outlines 8 key areas of life and what can be done within each of these to increase health and health equity. What we will talk about today touches on several of these, but in particular in early life, education, participation, and healthy behaviors. As always, the life course perspective is essential, and the foundation for health and health behavior are laid out early in life. We are here today to discuss and learn about how we can, as a society, promote health by enhancing the good and counteracting what is negative when it comes to 3 major issues, as you have heard several times. The relatively new technology of digital media, loneliness, and the changing patterns of leisure time and of physical activity, by knowledge and different policy measures, and what different stakeholders do. If efforts to promote health by enhancing what is good and counteracting what is negative are to be efficient, they need to be based on what the target group's needs and requests that we know. Therefore, listening to those it concerns is vital. Besides, for young people, the solution to these issues are connected, as you can see on the quote. From a public health perspective, it is strategic to focus efforts to where they may improve conditions for the population in many ways. Creating possibilities for social connections and meaningful leisure time with, for example, physical movement requires that different sectors work together and at all levels of society. Conditions for health are created early in life, and life course perspective is essential, and we all have a reason to act. Thank you very much.
Thank you very much, Karin, for giving us a good start and a good background information for all of the 3 themes. Just before I let you go, just one brief question. Now that we've heard both from a public health point of view, but also from the Swedish Presidency, that these 3 themes are important and crucial, what do you hope to take away from today's conference? What are you hoping that we can achieve by gathering here today and discuss these issues?
I mean, these issues are common for all the Nordic countries and the surrounding areas and in the Western world. And from today, I really hope to learn a lot from our neighboring countries and be inspired about different activities and different targets or goals that has been set. So I really look forward to learn from our neighboring countries.
And there's a political ear also. This ties into the Swedish government work on a number of these issues, so that there is actually a...
Yes, so we have several remits from the government that we are to focus on these 3 areas, so they are really high priority for the Public Health Agency.
Thank you very much, Karin.
Thank you.
Now, as we send Karin off the stage or the screen here, I might say, it's time for us to get ready for our next speaker. And I'm happy to introduce to you Katrine Bach-Habersat, who's representing the WHO Regional Office for Europe. Katrine, she's leading the Behavioural and Cultural Insights team at the Regional Office for Europe in the WHO, and is an expert on understanding and addressing barriers to healthy behaviours. Katrine will give us both an international perspective on today's theme, but also give us a short introduction, I might say, to behavioral and cultural insights and how these insights can be used to better achieve public health or improve public health outcomes. Katrine, the screen is yours.
Thank you very much. So my field of work is behaviors. Behaviors are absolutely essential to health. What we eat and drink, and whether we vaccinate, attend cancer screenings, whether we are physically active, whether we engage with each other socially, all of that affects our health. And of course, all of the behaviors of health workers, of social workers, and everyone else affects all of our health. And it was really with recognition of this critical role of behaviors in health that our, in WHO Europe, 5-year plan, which has an overall plan of ensuring equitable health, access and protection for all, that plan highlights behaviors as essential and as a flagship program for reaching this overall goal. Now, if we say behaviors are critical for health, the next important message is behaviors are critical for health equity. Because it's quite well known that those with fewer years of education and lower income, those who are excluded, stigmatized, that they experience poorer health outcomes. And this is not least because all of these factors also predict our health-related behaviors. Now, traditionally, there's been this tendency to categorize behaviors as an individual issue. In my childhood, the big campaign in the 80s was, you become what you eat, du blir hvad du spiser. So for me and my family, that was a message we were able to understand and act upon. But what about Birte, whose single mother was an alcoholic? Or what about Henrik, who received extra classes and support to keep up in school, and whose parents were unemployed and had similar low health literacy and literacy levels? When faced with hardship, exclusion, stigma, prioritizing health-related behaviors can be difficult or even impossible. Behaviors really are rooted in very complex individual and contextual factors. And we have to acknowledge that while behaviors are, per definition, performed by us as individuals, the responsibility for these behaviors in our populations must be a shared one. Many of you have probably seen this illustrated as you see here. It's really not about offering the same services and information to everyone, but it's about offering the right kind of support so that everyone receives and achieves the same health outcomes. And in my childhood, that meant Birte and Henrik needed much more support than I did and than my family did. This is a good illustration for health services, for health information, but I think for health behaviors, we have to go one step further. So what we want to do is to explore the barriers that people are experiencing and addressing those behaviors so that people are enabled and supported to engage in these behaviors. To do this, we need to move away from broad-scale population approaches, such as information campaigns that target the entire population. We need to stop relying on our own assumptions about why a certain population group is not engaging in a certain behavior. And we need to stop thinking that we can come up with the best solutions for other people. So we need to invest the necessary human and financial resources into exploring, understanding, gaining insights into the contextual and individual factors that affect a specific health behavior in a specific population group. And then we need to use that insight to develop evidence-based, evidence-informed health policies, health services, and health communications, interventions that are co-designed by those who are affected, and then evaluating those interventions. Now, you may have noticed that we've added a C to the classic behavioral insights. This is because we wanted to acknowledge and also highlight that individual factors such as knowledge and motivation are just one side of the coin. To truly understand and address behaviors, we need to take the socio-cultural context as well as the structural context into account as well. Is this behavior accepted by their peers? Does the community support them? Do they have access? Do they know how to access services and information? Now, using this logic, we will of course not be able to provide any final conclusions to our 3 wicked questions that we're discussing here today, because the logic is that we need to engage with those who are affected and understand the complexity of these issues and work together with them to find the way forward. And then if we add an extra layer of equity, if we are trying to support those who are already experiencing disadvantage, financial deprivation, poor health, disability, exclusion, stigma, then what can we do? The answer, of course, is complex and comprehensive and multifactorial, but I will share a few evidence-based principles that we can apply in our process. The first principle is tailoring. In the unit that I lead in WHO Regional Office for Europe, we adhere to this principle to a degree where our overall how-to guide on behavioral cultural insights is called Guide to Tailoring Health Programs. We know from evidence that broad-scale population interventions really don't have much of an impact for those who are experiencing disadvantage, such as the You Become What You Eat campaign in my childhood. Instead, we explore the complex barriers faced by individuals or communities so that we can focus our interventions to overcome these the best way possible. And I'm just going to share an example of what that means in practice. A few years back, I was involved in a project in London related to the ultra-Orthodox Jewish community called the Haredi community. There'd been some measles outbreaks indicating low vaccination uptake, and there was this general assumption that this was probably because of some kind of community resistance, maybe even religious concerns about the vaccine. And then we engaged with the community, with focus groups and interviews, also with their service providers, and it painted a completely different perspective. It was a picture of a family, in particular women, with extensive responsibilities, often large families, many children, a rules-based community. And in this context, taking your 5 small children to a health clinic that had a very small waiting room and there were no toys and no place to put the buggy and no place to breastfeed the little one in private, that just became a very low priority. And this was confirmed by the data. It turned out that older children in families were generally vaccinated and the younger ones to a smaller and smaller degree. Now, the response was to offer more flexible appointments, better communication, child-friendly facilities in a few places, and also opportunistic vaccination when they were coming around the facility for something else anyway. Now, imagine the waste of money if we had gone with the initial assumption that we needed to address community resistance, and also imagine how that would have not benefited that community at all. The second principle relates to engagement of those who are affected. I've already mentioned that before. This is critical at all stages, from fundamentally understanding the barriers and drivers they are experiencing to co-creating the solutions that are feasible, acceptable, and effective for exactly these target groups. And I'd say the more marginalized, the more excluded a group we're focusing on, the more important this is. For example, particular minority groups or religious groups or gender and sexual identity minority groups. Here, trust can be low, and solutions offered by, let's say, official authorities could have very low acceptability, whereas solutions offered by the community itself could just be more acceptable. This means the same solution may have different impacts depending on who conveyed it. Think about zero sorting among HIV-positive individuals, meaning a strategy where you search for a partner who is also HIV positive as a way of having unprotected sex and avoid infecting others. This solution came from the MSM, Men Who Have Sex with Men community. And it is really well accepted in that community, whatever we think about it. Had it been, let's think about a scenario where this has been proposed by a politician. I think the reaction might have been that this is completely inappropriate and unacceptable, but it came from the community and it's well accepted today. The third principle relates to this concept of positive deviance, which basically just involves studying the behaviors of people who are experiencing disadvantage and then, despite all odds, are having significantly better outcomes than what is usual or typical for their group. This may be young people engaging in leisure and community activities despite being part of a cultural community that generally is excluded from society or where they don't have a tradition for or values that support this kind of leisure activities. Who engaged the person? What made them engage in the first place? What keeps them engaged? How did they overcome the barriers which so many of their peers did not? The next principle relates to use of policy to change social norms. This is well known from tobacco and smoking, where forbidding smoking in restaurants was met with low public support originally in the broad public, but today is a social norm in many places. One of our wicked problems today relates to the use of social media. Studies by one of the spearheads in behavioral science, Cass Sunstein and others, have shown that many people feel they lose welfare from using social media. And then at the same time, when you ask the same people, how much money would it take for you to stop using social media? They say, oh, it would take a considerable sum. So in other words, people would demand significant money to stop using a product that they wish didn't exist. However, the same studies explored a different scenario. What happens if everybody else stops using social media at the same time? And the response is that the same respondents would be willing to pay money for this scenario. So from a behavioral perspective, asking individual parents or individual youth to tackle social media use is very difficult when the surrounding society and norms are quite the opposite. Many countries are considering various forms of regulatory approaches, recommendations, and this may be an important feasible way forward. But of course, such policies can really only be accepted and adopted by broad parliaments and successfully implemented and enforced if there's a level of public support. And in the unit that I work in, the BCI unit, we're just about to launch a document with policy considerations on how to maximize public support for health policies. So that might be a place to go when it's out very soon. The next principle is about thinking outside the box. Arts and cultural engagement have already been mentioned. It's a way to tackle some of the wicked challenges that we're focusing on today. There are studies in the UK that show that school children who read daily for pleasure or engage in out-of-school activities display about 30% lower levels of hyperactivity and inattention later on in their school lives. There's a recently completed Danish arts and health project that involved modified folk dance for young people with stress and anxiety that showed a significant increase in mental health, well-being, and feelings of loneliness. And then the last principle relates to evaluation. This is always important, but more so for interventions involving those that are already vulnerable. Scared straight, as you see here, it's a good or rather maybe a bad example that we have to learn from. For many years and across a range of countries, young people considered at risk of criminal behavior were enrolled in this program to visit prisons and meet inmates, warning them against the risks of a life in crime. And this was really generally considered a very successful initiative targeting some of the most vulnerable youth. And then, after many years, a group of researchers did a review of 7 randomized controlled trials and found a significant difference between those that had engaged in the programs and those that had not. The program actually increased the risk of criminal behavior. So, in conclusion, socioeconomic conditions, exclusion, stigma, really all predict health-related behavior. And from an equity perspective, it is essential to enable and support and sometimes restrict these behaviors. And in doing so, there are various considerations that we can take. We can tailor our solutions to the conditions and concerns and situations of those who are affected. We can engage those who are affected. We can look at those who do well despite all odds and learn from them. We can use policy to alter social norms. We can think outside the box, think about arts and culture, and we can invest in evaluation to make sure that we only do good and we do no harm. Thank you.
Thank you very much, Katrine, for helping us understand some of the barriers behind health behaviors or unhealthy behaviors. I'm sure that will be very useful in the discussions later on today. Before I let you go, just a few questions. First, I mean, the behavioral insights and cultural insights is still a fairly new area of work, or a fairly new way of working with public health. How do you at the WHO help both motivate and support health agencies in the different countries to actually work in this field in this way of working?
Well, so the region that I serve includes 53 member states across a very large, very diverse...
So you're busy.
Very large and diverse region, stretching from Kazakhstan and Kyrgyzstan to the east and over to where we are now. And as you can imagine, it's just a region with a lot of diversity. But what's interesting about this field of work is that the member states generally feel that they have much more in common than what divides them. And in terms of this golden combination of, on the one hand, applying a more scientific, a more evidence-based approach to behaviors, a more rigorous approach to health behaviors, and then at the same time, a much more people-centered, engaging approach where we ask those who are affected to help co-create solutions. A lot of countries feel like they're not there yet, and it's not very well integrated in the way that they work. So what we've done is we've created a community of practice, and all of the countries have nominated focal points for this area of work, and we meet every other month and discuss some of these same type of wicked challenges and what can be done about them. And I think that we get very positive feedback on that. Those who are engaged is really, really enthusiastic about learning from each other, seeing what other countries do and learning from that. In addition to that, we develop various forms of guidance and policy considerations documents. I mentioned a few. We do trainings, capacity building, and then we do actually work directly with countries as well. So if a country has a wicked challenge like some of the ones that we're talking about here today, and they would like to invest in that, and they ask us, can you help? Would you like to engage? We're very happy to do that, provide advice in the process.
Now, just out of curiosity, I understand that countries are also reporting back to you at the WHO if they're working this way. I'm just curious, how are the Nordic countries doing in this way of working compared to other countries?
I'd say the Nordic countries are generally reporting at higher levels and are doing more than many other countries in the region. So that's really, really nice. But as I mentioned before, countries also feel like they have more in common than what divides them. And I would say that the Nordic countries that are very engaged in this community do feel like they have a long way to go in terms of applying more robust methods and people-centered approaches to health behaviors. And moving away from this tradition we have of doing information campaigns, as while we all know that it's not going to change behaviors, but we still feel like it's a way of showing we're doing something.
So if somebody feels hit by that and are still working with campaigns and you say that they don't work, what are your main recommendations to professionals who might be curious in working this way and learning more about actually using behavioral and cultural insights to change public health outcomes?
Well, one thing to do is to find out who the focal point is for their country. And we're very happy, I think my email address is there, so I'm very happy to share who the focal point is for the individual country. We have some online training that anyone can take. It's free for anyone. I think it's 4 or 5 hours, self-paced. And anyone can also sign up for our facilitated online training. So this is a combination of the self-paced module, and then there's group work where everything that you've learned online is applied to a case example, and you go through that case example with your group to try and apply it in practice. So that's an option, at least, to start with.
Perfect. Thank you very much, Katrine. We live in a region that is renowned for its quality of life, but how do we ensure that all youth, regardless of their background or circumstances, that they actually have access to meaningful and active leisure time? That's the first question that we'll try to address today. This ties back to the question posed by the minister this morning: how do we get all children involved in leisure and community activities? These activities in the Nordics are often run by voluntary leisure and sports organizations in the civil society sector. This is both a strength as it taps into the power of community, but it can also imply challenges, among others, related to the costs of participation. Throughout the discussions today, we'll try to explore different lessons learned from different countries in the Nordics that have tried to address this challenge and these problems in a different way. The theme of meaningful and active leisure time for children and youth has been determined by the Swedish Presidency for the Nordic Council of Ministers, as you already have heard, and this is following a government initiative in Sweden to develop a model for prepaid leisure cards here. And therefore we'll get insights into the different models of providing leisure cards, or at least different access possibilities for leisure activities throughout the Nordic regions. But before we look into the lessons and the models from both Finland and Denmark and Iceland, I'll be joined here by Madeleine Larsson, who is a senior analyst and a project manager at the Swedish Public Health Agency. And she'll help me introduce shortly the current work done here in Sweden. So, this is one too far. We'll go back here, and I'll join you over here, Madeleine. Welcome here on stage.
Thank you very much.
First, can you give me a short background on the government initiatives on developing a leisure card here in Sweden?
Yeah, so I'd say there's many factors to that one. I think we need to work with health promotion and prevention through all age groups in Sweden. But I don't think anyone would disagree on the fact or importance of children having a great childhood with meaningful activities. So every child has the right to play and engage. And we need to ensure equal opportunities. And as we heard the speakers earlier today, that this is not the case. We see that children in low-income households have lower access due to economy issues, and also children with different disabilities or special needs don't have the same access due to accessibility issues. So, yeah.
Is there a special timing or reason why it's now that the Swedish government is introducing this model and has targeted you with the challenge to actually develop a model?
I'd say one of the aspects might be also the pandemic, the COVID-19, that we saw that half of the school children ages 11, 13 and 15 stated that it disrupted their activities. So we need to get them back into the meaningful activities. That's one part. But, you know, we also stand in front of many public health issues. You know, we need to work towards equality in health. And that's, you know, we need to, you know, work harder. And the leisure card might be one piece in the puzzle that can, you know, that can work on the issues loneliness and physical activity and social interaction.
You mentioned several different things that can be achieved. Are there some main goals or objectives that coming Swedish leisure card model should try to aim at or propose?
Yes, of course. It's the meaning is that we're supposed to provide all children ages 8 to 16 years old a meaningful leisure time. And it's about increasing access. So we need to focus on the children that are not there today. So the ones that I mentioned earlier, the ones that are in low-income households and the children with different disabilities, we need to address them particularly. But also, it's a way to, you know, empower the local community as well, to raise awareness of the local, you know, power, and to promote safety and belonging in daily life. So that's one of the aims as well with this card, I think.
And now you've been tasked with just to basically develop this model. What's the timeline for this? When should it be ready? When is it the plan that you need to have a model that can be rolled out in Sweden?
So there's lots of people working really hard now to get this launched in time, but we don't really have a date yet. But during next year, I'd say around middle of next year. But, you know, many people are working hard, so hopefully during next year, 2025.
Now, the Swedish government has also recently launched a number of different initiatives and given quite substantial funds. I think it's around 100 million Swedish kronor to the national sports organizations and several more initiatives. Now, before the leisure card is already there, or is even there, as a transitional support, because they've known that this will come future on. What are the objectives of these new initiatives, and why now?
Well, I think this is an opportunity for them to prepare themselves now for what to come, and to raise awareness and encourage, especially these children that are not there yet, to participate in these activities. So I'd say, you need to go out there and knock on doors and, be on the arenas that children are to engage. And also they need to recruit and educate leaders. And a third aspect might be that they need to invest in equipment or aids to increase accessibility to these activities for the children that have different needs and need different ways to get in there.
So you're already starting, even though the model is not there.
Oh, yes, that's true. But we're all planning what to do and how to do it together. So these are different aspects that we've been talking about. Yes.
So for the next little while at today's conference, we'll get insights from both Finland, from Denmark, and from Iceland, and the different models that are there, not only on leisure card, but broader also on accessibility, as you mentioned. Which questions are you looking for answers to for the process that you're working on, and what kind of inspiration do you hope to take with you from the next speakers here?
It's always good people doing stuff before you do it, so you can learn do's and don'ts. But of course, the big question is, how do you target? How do you reach out to the ones that are not there active today, the target groups, the ones that I mentioned earlier? I'm also interested, of course, how they followed up and measured the effects, and what were the results of these initiatives. And also, I'm quite interested in the communication along the way. Did they adjust certain things if they saw that they didn't really hit the target groups, so that the initiative were more successful? So that would be three things that I'm looking forward to. Might hear more about.
Perfect. Thank you very much. We'll be joined by you again a little later in a panel conversation, but first we'll try to find answers to some of the questions you just posed. I'm quite sure that there will be insights from both Finland and Denmark and Iceland that can hopefully guide the work that you're doing for a new Swedish model. So thank you so much.
Thank you.
As already mentioned, we'll seek inspiration and insights from different models that can then help and guide some of the Swedish work that is about to be done. And the first is the Finnish model for leisure activities that seeks to enable every child and young person to have an active leisure and use this as a tool to improve the well-being of children and youth in Finland. To tell us more about this work, it's now my pleasure to introduce Ina Berden, who is a special government advisor at the Ministry of Culture and Education in Finland. Welcome, Ina. The screen is yours.
Thank you very much. Hello, everybody. Very nice to be here. So thank you, organizers, for the invitation. So I come from the Finnish Ministry of Education and Culture, from the Cultural Department. And I've been working with these leisure activities since 2015, maybe. We started with a very similar questions what I hear today, long time ago. Of course, the topics hasn't disappeared, even if we have one big answer to this question. Call it the Finnish model for leisure activities, harrastamisen Suomen malli in Finnish. But it took a long time actually before we got into the model. So we actually started with one working group in 2016. So it took several governments before we had the model in practice. We also had another working group after that, because of another minister, because many ministers want to have their own working groups. So we had another one with a leisure activity strategy working group. And after these two working groups, we ended up to the model, which was actually very simple. It's only 1.5-page model, and which created the Finnish model for leisure activities, what I introduced to you today. Actually, we also had a hobby card, so we also tried that, but that didn't actually work, but maybe I don't go back to that now. So, here you can see some basic elements. So actually our main aim is to increase the well-being of the children and the young people. We are aiming at children in primary and secondary school, so age of 70 until 16-year-old children. We had an existing model when we started. It was this kind of after-school activities, but it didn't really work well. It didn't have a very good reputation among children, so they said that I don't want to go to the school's clubs because they are something else than what is happening in the evenings. So our main principle was to make something so high quality that there is no difference to the hobbies in the evenings. I know the English word hobby is not the right one, I should use leisure activities, but as in Swedish language you also talk about hobbies, so I will now use word of hobbies. So we wanted to create actually a new model beside the existing one. In the existing one there was mostly teachers who got extra income for their job. They were doing activities that actually teachers wanted to do. So the music teacher was doing music club, and and the sport teacher was doing sport club. So there was no connection what the children wanted. And we wanted to change this. This was the radical change. We wanted to create a model where children can say what kind of hobbies we bring to each school. So we needed a data. And we needed to create a pupil survey, which was, I think, the key element of this our model. I go a little bit faster now because the time is running out. Well, this is actually what our going back. Sorry. No, I'm going back this way. Let me take you back to the minister picture. No, this goes wrong way around. Just a moment. Oh, maybe I don't get backwards, do I? The bottom. This one. Yeah, sure. Sorry. Sorry for a small technical. So, this is how it looks like. Here is our minister. Minister has changed. Now we have a Sari Multala, but this was the former minister, because we do this survey every second year. So last time we did it was 2022, and coming autumn we do this again. This survey is sent to every school child in Finland, and they what they tell us is so this is very high profile. You can see the minister is talking to the child. Why should you answer to this our survey? And we ask the child's age and the class. We don't ask a child's name. And then we ask, what would you like to try? What kind of hobbies you are interested to prove, to go and try? And then we ask, what are the hobbies that you would be definitely in if we organize that? One of these ones is like parkour. It's super popular, has been all these years, still is, especially among the primary school boys. So we have two questions. What do you exactly want, and what are you interested in trying? So we get two kind of information. And this is how it works. A child can move those hobbies closer to the middle of the circle or to the circle around the big star. And you know, there are so many hobbies nowadays, so we have about 80 hobbies that children has to go through in order that we are really answering to reflecting their world. So this is how the the hobby list looks like. And this is actually in Finnish, but what I want to tell you that children are super interested about so many things, which came as a surprise to us. We thought that they are mostly interested about sports and not so interested about culture and science and other things. We were completely wrong. They are as interested about art and culture as in sports, and they want to try so many things. So this is very good, actually, news, that it's easy to organize things as long as you know what they want. So, and this looks percentages, how many percentages of our children are interested at certain hobbies, so that they can see the percentages are very high. And this was the message to the hobby organizers, that there are so many people, we can say how many exactly actually, are interested about, for example, fishing. So then we activate those organizers who are doing fishing activities for the school children, and they really took this message very seriously and said that we have to get involved, we have to do this. And this was the key for the success, that we were able to get them active and go to the schools and organize the hobbies. Without them, this wouldn't have happened. So we don't have a special Finnish model teacher for children, but we have those high-quality supervisors, teachers who do the work in the municipalities. So the football in our model is the same football and as high quality as in the evening is the football, or parkour, or architecture, or whatever. So there's no difference. And when you talk about that you want to get involved the children who don't have hobbies, our approach to this was that we want to get everybody involved. So we don't want to target the children who are not having hobbies at the moment. We want to target everybody, because it is much nicer to go with all the children and your friends and your schoolmates, your classmates, than to end up somewhere with a children group of not having a hobby. So this was the one of the main features. As you see, the numbers answering to this pupil service are huge. We created one of the most successful data collection system. Of course, the teachers are helping us because children are filling in these forms in the classrooms. And here you can see some of the results. How we look at that boys and girls want different things, which didn't come as a surprise. The primary school children want different things, and the upper secondary school children. Here you can see some of the hobbies. I'm sorry, I have so little time that there's so much to tell to you, but I try to answer your questions. Then we also have some open questions in our survey, and what we, maybe it was the former one. No, it was the collaboration. Okay. Yeah, we ask it, what are the children, maybe it was the form, but anyway, I tell you, we ask it that what is the most important thing, why do you go to the hobbies, what does it make you feel? And it was very surprising that secondary school children, they said that because it increases my well-being. And we were surprised of that so young children, age of 12 to 15, were able to talk about their well-being and the leisure activities effect on that. The children who were smaller ones, they said that because it is fun and I like to do that. We have gone further on these questions. We had an assessment of our whole model that was 2 years ago, or maybe 1 year ago. Time goes very fast. And we asked it, we made this, it was a research institution who made it for us, and we asked them to make it very child-orientated, because this model was created to be as child-orientated as possible. So we wanted to make a research like how do children feel about our model, and we got excellent results. They focused on the 6 municipalities where this model has been successful, because we thought that if we just take randomly 6 municipalities, we might ending up why it doesn't work somewhere, and we thought that that's not important now. We want to focus on the what makes it successful, and especially from the point of view of a child. And we asked it, why is your what makes your hobby meaningful? And this was one of your questions here in the seminar. And it was very interesting that they said the interaction with the teacher is the most important thing. The genuine interaction, talking with the teacher was most important thing. So when it comes to mobile phones, I think how we can compete with them is to increase this genuine interaction with a child and an adult. And one of a very interesting point of view from the answers from the children was also that it should be without pressure. Many hobbies in Finland has a lot of pressure on children, coming from the teacher, coming from parents, from different directions. But children, they said that even if I want to work hard, I want to learn things, I want to learn new skills, I want to do things again and again, I want to really train to become better, because they want to get better and they always want to challenge themselves. But we want to do it without pressure. We want to do it on our space. That if we do something like a hard training, can we still talk while we're doing it? And this was something that we could only get this from the children, this kind of finding. And the other ones that we want to have a say what we're doing. It's not only that we want to have a parkour here in our school, but we want to talk to the children, to the teacher, how we're going to do it. What kind of things we want to learn and where we want to do parkour. Is it in the forest or is it in the schoolyard or inside the school? And the community, the feeling together was one of the reasons. So we are quite far with this question, what it means to have a meaningful hobby for the children. Actually, what we have, how this model spread enormously fast. We started actually in a pilot in 2021, and next year already we had more than 235 communities, and the communities we got them very committed, because the reason that they have a say what kind of model it is in their own village. So they have a lot of say for the implementation. So the model in Ylöjärvi can be quite different than in Helsingfors or in Vanda. So that is, I think that is one of the key elements too, to get the communities very committed. That means that we have a lot of collaboration. We have a ministry and municipalities. We have the hobby organizers. All of this, we work together. And I was just looking when how we started in 2016, and there we said that we need innovative laser activities to reach all the children. And I think that is what we created in the end, that we created a new model, innovative way to reach all the children in Finland. Here we have some more, and you can look it from the links. And this is our support team. And we have a contact point which brings together municipalities and the hobby organizers. And there's a lot of information if you need more. We put it to the legal basis in order to secure the continuation. But it is not very like a steady model. it is model that we are still creating all the time. So it's continuously in the process to make it better and better and better for the child. That's our main aim. So thank you very much.
Thank you very much, Ina, for a quick glimpse into the work you've been doing on the Finnish model. We'll get back to you on some of the questions and comments that can be in a little while. But first, I'll send you off stage, and then we'll move a bit southwest from Finland to Denmark and the municipality of Roskilde, about half an hour outside of Copenhagen. Many Danish municipalities have also developed leisure card models for children and youth, and one of them is the municipality of Roskilde. They've been developing their model and support initiatives over the past years, and this work has been led by Mikael Lind Olsen, who's a specialist at the Culture and Library and Sports section at Roskilde Municipality. And Mikael has promised to give us both a short introduction to the different ways that these leisure card models are done in Denmark, and then move on basically to put the most time on the specific model that you're doing in Roskilde. So welcome, Michael. The screen is yours.
My name is Michael. I work in the section of Culture, Library and Sports in Roskilde Municipality in Denmark. And Roskilde might be mostly known for the festival and the Viking ships, but we do this work as well. So I will introduce to you the work with our leisure card in Roskilde and some of the work around the leisure card. It's obvious that participation in sports associations and being part of these positive communities for children has a positive impact in other arenas, such as better performance in school, better health, improved networks, better general well-being and self-confidence, etc. But a group in society stands outside. Too many socially disadvantaged children are excluded from the positive communities offered by the sports associations. So to give everyone equal opportunities, we try to help these children who are not in these communities, to give them a helping hand to get there. In Roskilde, this Culture, Library and Sports section, we do this work on 4 levels to ensure the participation of these children. The first level is that we have a lot of efforts to introduce the kids and the families to the concept of sports associations, where the children can be part of these positive communities. The second level is that it's not always enough for the children and their families to hear about these sports associations, so we also have different efforts to get the children to the associations, to build bridges that they can cross to get there. But it's also an important factor that economics does not get in the way. So therefore we have the leisure card to aid the families to pay the membership fees. The fourth level, continuation, is getting the children to the clubs is not always the same as they stay there. Therefore, we have efforts to support the sports associations in their work to keep the children in sports. It's in level 3 and 4 I'll present some of the work we do in Roskilde, namely leisure card and social partnerships. And a disclaimer, I could talk about this for hours. I have about 12 minutes, so today I'll just scratch the surface. But first, a brief introduction to the leisure card in Denmark. In 2006, we had the first governmental attempt to start leisure card in Denmark. Municipalities could apply for funding for a few years to start the leisure card. Since then, new municipalities have had the opportunity to apply for funding to start the leisure card. Today, roughly about half of the municipalities in Denmark have leisure card. But it's an important thing to know about the leisure card in Denmark. It's a possibility. It's not an obligation for the municipalities. So after this initial funding, the municipalities have to finance the leisure card themselves. This also means that the form of the leisure card is very different across Denmark. Some municipalities only give aid to membership fees. Others support sports equipments as well, such as football boots. Others again have employed leisure counselors to help children to find the right sports, etc. The leisure card in Roskilde is actually one of the smaller ones. We only have 1 employee and a student assistant. The idea behind the leisure card in Roskilde is that economics shouldn't be an obstacle to participate in sports, or at least we want to minimize the economic challenge for the families. So, who can get the leisure card? Well, in Roskilde, and this is different from the different municipalities, but in Roskilde, those who can get the leisure card are children and young people between the age of 4 and 17. And they must live in the municipality and have some need of financial support. But, in fact, everybody can apply for leisure card in Roskilde if you have the right age, because families do not have to prove their income. To make sure that children and families who need the help applies, we have a network of professionals who see the children in their daily lives. This could be school teachers, healthcare workers, social housing workers, social workers, etc. And if they see a child and talk to it, or the child's family, and see that the child is not in sports activities, they try to guide them in the right direction. And if the families or the child are willing, they help the child and the family to fill in the application form for the leisure card. Families can actually themselves apply as well. And this often happens, we've learned, in social housing areas, where some families find out about the possibility of leisure card, and then they tell it to their neighbors, their families, and their friends. Since we in Roskilde do not have an employed leisure counsellor, we are heavily reliant on a network of professionals. And that is one of my tasks, is to maintain this network. And what help can the leisure card in Roskilde offer? Well, the children can apply for financial support for the membership fees for up to 3 seasons, and financial support to attend in sports camps. That's it. And we know for a fact that in many cases the leisure card is all the family needs to help start playing sports. However, some families need more help. And that is which we have supplemented the leisure card with other ideas. One of these is social partnerships, which I will now introduce you to. Do you remember the 4 levels from the beginning? Now we are at continuation. We have made partnerships with 7 different sports associations in Roskilde to support their work with the disadvantaged children. These are the club logos you see here, and they represent all kinds of sports, for example, basketball, football, handball, gymnastics, etc. The background to the social partnerships is that we have learned that some children drop out of the sports associations really fast, and they never come back to any of these communities. To try and prevent this, we now have implemented the concept of social partnerships. And the concept is that we, as a municipality, provide financial support to specially selected sports associations so that they can employ a so-called resource person. This person will work within the sports association in various ways to improve the chances of continuation. With this money, they can employ the resource person for about 10 to 12 hours a week. Some of those associations supplement our funding with other funding so that they can employ a resource person full-time. The work that are done in the Social Partnerships Association varies, but all aim to improve the chances of the continuation of the children. One of the keys for continuation is to make sure that you feel welcome the first time you come to play football, handball, whatever. That will build the chances for you to come the second time, the third time, and so on. Another key to ensure continuation we have learned is close contact with the parents. So this is something the associations put in an extra effort into. It's not always easy, but it's really important. Also, some of the work is about upgrading the associations as a whole. For example, in a football club, that all of the coaches on all of the teams understands the concept of the good welcome, and that they all know about the work of the resource person, so that whenever they feel the need for a child, they can ask the resource person for help or advice. But does it work, you might ask? Well, during COVID-19, for example, we saw a massive drop in memberships in sports associations all over Denmark, also in Roskilde. Through a lot of work, online or by phone, the social partnerships associations managed to not only keep their members, but have actually seen a slight increase in membership in this period. In my opinion, one of the reasons for this is that these associations have managed to create a very strong and positive community for their members, where they feel they belong. Another result. In the autumn of 22, we did a small survey of all the young people and children who had received a leisure card for the first time. We found that all of the children who had started in a sports association that was not one of the 7 social partnerships clubs, only 59% were still member. When we looked at those who had started in one of the social partnerships associations, we had a significant higher number level of continuation. A whopping number of 83% were still in the association. This is a significant difference. We will repeat the survey this autumn and hope that the numbers will be even better now that we're free from the COVID shutdowns that most likely affected the results of the 22 survey. To sum it up, in Roskilde, we have learned that the leisure card makes a difference for a lot of families and children. But it cannot always stand alone. It will therefore make an even bigger difference when we support the associations in which the children get their memberships. It will increase the chances that the children continues in an association and thereby get all the social, physical and mental benefits of being in a positive community. Our experience is that when we as a municipality supports the sports associations in their work with disadvantaged children, the output we get is far greater than the money we put in. The total cost of the leisure card and the social partnerships in Roskilde in total is very small compared to, for example, the price of a person being in prison, the price of foster care, and the price of children and young people not having equal opportunities for meaningful and active leisure. Thank you for listening.
Thank you very much, Mikael, for this short introduction. We'll get back to talking about some of the different aspects of this. Also, as you point out, this is not just about a leisure card. There are so many other aspects and part of the problem that we need to tackle. Madeleine was also talking about it earlier, that there are several issues around getting young people to sports that we need to address. So thank you so much for this short introduction. You'll be back with us in a little while to unfold some of these perspectives. So thank you. Now I'll move over here a bit more to the northwest, to Iceland. And to you, Margaret Lilja Gudmundsdottir, you're the Chief Knowledge Officer at Planet Youth, which is a research consultancy that has been involved in developing the Icelandic prevention model, which also includes a leisure card model, but also has different elements that we'll talk about. I have a number of different questions to ask you about the experiences also with the leisure card and engaging young people in organized leisure activities in Iceland. But first, for those of us who are not fully familiar with the Icelandic prevention model, can you give us just a brief introduction of what the model is and what it aims to do?
Yeah, I try my best, and thank you for inviting me. I'm absolutely loving this so far this morning. The Icelandic prevention model is actually just the title of what we've been doing in Iceland for more than 20 decades. It's a data-driven primary approach, upstream prevention, and I absolutely love listening to our colleagues here this morning talking about upstream, the importance of doing this kind of work. And the Icelandic prevention model is, like I said, data-driven, so we are looking into the local community of our children. We focus on the 4 domains: family, peer group, school, and leisure time. And that's where we have the leisure card.
As you say, this is much more than a leisure card, which is just an element. Can you tell us a little more about some of the specific measures that has been taken in Iceland to increase the opportunities for young people to actually engage in organized leisure activities? What are the tools and the levers that you pull?
We saw when we started to work with data and local community that sport or other leisure activity can have a really positive and preventive factor when it comes to substance use and well-being of our children. So we started actually Reykjavik. It's a municipality-based leisure card in Iceland. It's mainly municipality-based. So each and every municipality is founding the leisure card. And it started in 2007. So we have used, and when I say we, I'm of course not talking about only us at Planet Youth, but just like people working in this area. And we focused a lot on quality of what is offered to children, the criteria. We are not with volunteers in the work in Iceland. People working in this area are get paid for what they are doing. Volunteering is of course really important. We cannot, probably never, offer as many opportunities like children in Finland have. We are a little bit fewer in Iceland, as you probably all know. But it's the key is that we want to make sure that we don't have what we call often non-doers, children that are not participating. So I think both to have like high quality professionals, both within the sport and other activities, we actually see it's the grown-up person in charge who has the preventive factor when it comes to children's well-being. It's not enough to have a leisure card or build a football stadium. You have to have people in charge who are responsible.
You mentioned that also that the model was first developed also to reduce drug use among young people quite a few years ago. Is this still the focus, or is there a broader scope now relating to other health benefits of an active leisure?
We often get this question, and sometimes people think because Planet Youth is now implementing the Icelandic prevention model worldwide, actually in 18 countries, there is no magic happening in Iceland. We have not done anything to our children. We used to be on the top when it came to substance use and alcohol drinking. Now we have the lowest number. That's I'm telling regarding just ESPAT data from 2019. So that's always going to be our biggest challenge, to make sure that the numbers for any kind of substance use are low. But we are also using the same methodology to reach out regarding well-being, screen time, too much screen time, lack of sleep, nicotine pouches, energy drinks, that we are making sure that we are offering children today also different kind of opportunities within the leisure time, for example, e-sporting, gaming, so that can be also in an organized way. Yeah. So I would say, of course, we can never forget to talk about, prevention when it comes to substance abuse, but well-being in general is our biggest focus today, I would say.
But I also know that you have quite a lot of focus on some of the newer, substances might be a wrong word, but both the nicotine, as you mentioned, but also you also told me that the energy drinks is also a focus for you with high levels of caffeine for young and undeveloped brains or developing brains. What are your thoughts on other issues that we need to be aware of here?
No, this is like what we have to make sure when we are, and Planet Youth and Icelandic prevention model is all about collecting data, information, interviewing our children through the questionnaire. So we have to be absolutely sure that we are asking about the right things. We must know what we are talking about. We have to build all our action on data. And what we've seen for the past years, e-cigarettes, energy drinks, nicotine pouches, like I said, our teenagers in Iceland or elsewhere in the world, they are kind of all the same. You just have new things that pop into their lives. So if you have a community and this village that we often talk about, it takes a village to raise a child, then you have the tools. It's a community. We are not putting the responsibility on the individual or the child itself. It's a community work. We have to make sure that the community, the village is working towards well-being of our children.
Now you've listened to both Ina introducing the Finnish leisure card model and Michael introducing a Danish model. As you said, what is it important to bear in mind and to know about the differences between the different models and the model that you have in Iceland?
I think it's important that we create our own. So I'm not here to be arrogant and say this is what you should do and this is what not. First and foremost, I am super happy to see how we are working now upstream, doing upstream prevention, because like Michael mentioned earlier, what you put into upstream work is going to pay off later on. I have a dream that this has nothing to do with politics, so it doesn't matter who is in charge, who is leading the work from the government. I may be more keen on municipality-based work because that's kind of the local community surrounding our children. But let's not make this about politics. Let's at least get all politicians on board thinking the same way, that we need to think about in upstream way. I would also highly recommend that you train the coaches, the people working within the leisure activities, because we are asking them to do all kinds of new things. You know, if I'm a soccer coach, my main concern is to train soccer. But if I'm part of, you know, upstream prevention work, you know, you are also asking me to reach out to children coming from abroad. You are also asking me to deal with the too much screen time use, talk about sleep and well-being. So I think it's really important that I'm not saying they have to have, now maybe the coaches watching me are not going to be happy. They don't have to have a high salary, but recognizing their importance is all this and not relying on volunteers, because this can be a tough, and we are asking our professionals within the leisure card or within the leisure domain to add to already quite full table.
I know that some consider the Icelandic model to be a quite expensive model, partly because it's a bigger model with more elements, and also, as you say, it's not based on voluntary work, but it's paid workers who are doing very important work. Can you say a little more about how the model is financed? And also now you say that you don't want it to be about politics, but still you and others around you have still managed to basically convince different either politicians or cities or municipal managers to actually invest in this model on a long-term base. So how's it financed? And how have you worked to basically make sure that these investments are actually done in children and youth in Iceland?
Okay. The latest number of money spent into this in Reykjavik was 7% of the total budget of Reykjavik city is going into leisure, organized activity, not only leisure card, but you know, housing, sport clubs, youth clubs, swimming pools. Costly, it's upstream, it's primary prevention. And I know that we are spending way much more money on treatment hospitals. So I'm not the right person to try to agree that this costs much, you know. I think also that, of course, this started as, you know, actually the action taking towards substance use of young people in Iceland started with politicians in Reykjavik, many of them women in charge, leading, asking about different kinds of things, you know, hot meal during school day, organized activities, the town full of children drunk during night is not something that we can deal with. Of course, this started as politicians on board. But I think, you know, at least now, and like I said, this has been running since 2007, so this is something that parents are relying on. And of course, this only covers the cost. And something I want to add as a recommendation for both, you know, other countries, not only the Scandinavian, but other countries, that we make sure that we are educating parents and caregivers about the importance. And that's probably our biggest challenge now in Iceland, to educate parents coming from abroad. So this is something we have to cue in. We have to make sure that we all know where we are heading.
Sorry, the air is all dry. You're also working with exporting the Icelandic model to other countries. What are your main recommendations if other countries are interested in actually learning this way of working and introducing it to their countries?
Yeah. Actually, Planet Youth took the Icelandic prevention model and created process structure tool for our partners. And like I said, we are now working in 18 countries. First of all, it's data-driven, so we have to collect data, create a coalition, make sure that you have fully employed people working with this within the field of prevention. And I'm not only talking about leisure, just prevention work in general. You have to know how the situation is, to know where you want to go. You have to analyze you know, it's data-driven, and you know, I work a lot with data, so you hear clearly that's the key. Evaluation, like mentioned here this morning, evaluate, look at what you're offering, is it of high quality? And that's often, you know, we see the same risk and protective factors when we are working with our partners. Many of the preventive factors are the same, spending time with parents, showing caring and warmth, having friends, and so on. But there is often lack of preventive factor when it comes to the leisure domain. And then we have to add to it to create that culture and often change the culture. Like we see, you know, football, for example, is not always a preventive factor when it comes to substance use. It can be a really high risk factor. But it doesn't mean that we can't use football in the leisure domain. We just have to build and change the culture within when it comes to children and adolescents.
Great.
Now let's broaden the conversation and also include the other speakers in these sessions in a little while. But first I'd like to show you a short film with some young voices and their views on leisure time. The film is done by the Nordic the Nordic Welfare Centre, and it is in Swedish, but it's texted to English. So it's here.
Alltså det man gillar att göra helt enkelt, ska jag säga. Alltså, att man rör på sig med huvudsakligen att man också tycker det är kul, att det är liksom något man tycker är roligt att göra är bra. Men det så viktigaste är att man rör på sig också samtidigt.
På fritiden brukar jag vara med vänner eller vara med familjen. Jag tycker att det är jätteviktigt att man rör på sig.
Vara med kompisar, för det är väldigt bra att ha bra kompisar och vara med kompisar som gör dig glad. Och sen också, ja men någon sport kanske, eller någon hobby som du gillar. Det behöver inte vara sport, men det kan vara kanske, jag vet inte, spela ett instrument eller rita eller något sådant.
Jag brukar köra mycket sport med mina kompisar, säg golf, det är hockey. Kan hända att jag spelar tv-spel också med mina kompisar så. Ja, det är vad jag brukar göra på fritiden.
En bra fritidsaktivitet är väl spela fotboll. Spela fotboll.
Perfect, thank you for this. Now I also managed to get a little bit of water in this dry air studio. And now I'm joined here after the film with Margaret, continually from Planet Youth, Ina from the Ministry of Education and Culture in Finland, Madeleine from the Public Health Agency in Sweden, and Mikael from the Municipality of Roskilde in Denmark. Madeleine, I would like to start out with you, as you have a specific task to develop a new Swedish model for leisure card and active youth. What have you learned from the different presentations and talks we've been given this morning from both Finland, Denmark and Iceland?
Yeah, there were many aspects that were really interesting to hear more about. I enjoyed listening to Finland that used the school as an arena and to actually engage children directly when they're in school. The pupil survey was enormous. That was really impressive. And the cooperation between the hobby organizations and the school, I think that's really a nice example where you get children more active. Denmark, I was, the equal opportunity work that you were putting out there, and the fantastic collaboration between the social partners that actually led to better results was interesting to learn, to hear more about. And of course Iceland, that we've been listening to for many years, with the upstream prevention, the local communities. It's impressive as well that the Icelandic model includes so many arenas, not just activities, leisure time activities. Yeah.
One issue I would like to talk about that several of you have mentioned is regarding effectiveness and impact of the different models. Ina, you presented a fairly centralized model from Finland. Have you evaluated the model in terms of effectiveness? And so, if so, what is the conclusion? Does it work, and which results is it creating?
Yeah, we did once. This was this assessment or evaluation that I mentioned, and we focused on the 6 successful municipalities, different size. So that was very encouraging to continue. I also want to mention that we have also had many projects to develop the model further. So we reserved 2.5. We haven't talked much about the money, but so our model is 17 million per year, or 14.5 million per year.
Euros.
Yes, euros. And we had 2.5 million for projects to develop the model further in order to add inclusion and reaching disadvantaged children. We even created this kind of, which was actually quite, I think, very innovative. We created a hobby secretary, which was common to all the small organizers. So if, for example, a fishing club has so small resources that they cannot actually, negotiate with the municipality and organize these things, then we have this kind of one research for many organizers who they can use, and this has been working also very well. So we have been had this kind of projects too, and I think one of the main ones was that we started educating the teachers, the instructors for pedagogy, because we noticed the same, that many children in hobbies they stop at the age of between 12 and 15, and this is quite a big problem actually, and we always accuse the teenager, the age, that it is the age, and you know, friends are more important. But I don't think so. We've been trying to, you know, prove that this kind of idea is wrong. That this is about how the organization answers to children's or youngsters' needs, and mostly they don't. They continue the same way as they always did. When you are a teenager, you need much more interaction. You need much more.
So that goes back to what Katrina was mentioning earlier, basically understanding the needs of the target groups.
Exactly.
What kind of behavior do we see, and what is it that we need to address?
And we did this kind of course in the internet, but it was live course. And it's super popular. One of our most popular courses in Finland, like all the time full.
Just continuing on this effectiveness and impact question, Michael, I know that you've been developing the Roskilde model to be quite cost effective given the sum of money you've been given from the city council. Not that I'm sure that you could spend much more, but given the resources you have, you've really tried to develop in a way that is as effective as it can be. Can you share some success stories or case stories that shows us or illustrates, I mean, the benefits and the impacts that the model actually does, and that you use to consider to convince the city council that they should continue to invest in the model?
Yeah, and I have a lot of stories, but I saw a few days ago a number in Denmark saying that about 5% of the school pupils in the public school has some kind of school refusal. Which means they have a hard time going to school, they have problems, they isolate themselves, they sit at home. And I have a case with a girl who had school refusal, sat at home, had no friends. The few friends she had was bad company. She was going in the wrong direction. And her father got her into one of the 7 social partnership clubs. And in there, the work they had, the possibility as a social partnership club to do was to be around her, and in time her personal coach, the coach for her team, got her personal mentor, not in an employed way, but just it happened, and that's what these organizations can. And in a year's time, she went from sitting in her room, feeling sorry for herself and not being in a good place, to actually be integrated part of the team, to spend a lot of her other leisure time in the club, on the other teams, and she's back in school. And then a year after she started, I saw her. We had this market day where a lot of sports associations showed what they could do to gain new members, and she was one of the leading in the field to try to recruit new members just a year later. And that's just a perfect example of what this mostly volunteer work can do.
This also touches upon both access and inclusion. And Margaret, I'm curious to hear from you also. What do you do in Iceland with the model that you work with to ensure that an active leisure is actually available for all children? I mean, also those who come from different backgrounds, which means that they have less opportunities to start with to actually come into the clubs or the sports organizations.
Really good question. And this idea of reaching all children, that's our goal. Like the goal regarding substance use is 0. The goal should be everyone. And we are not there. And we know that we have challenges. But I both echo what you've been saying, you know, when we have a teenage year, they would tend to drop out. Then we have to address it. Okay, make sure that they have something they would really like to participate in, because they complain it's not fun anymore. It's too much focus on competing. And then also the beautiful stories that you were telling, because we know that the people within the leisure domain, they have extra. extra factor. You know, you talk to a teacher or the coach or the youth club worker in a different way than you do to your parents. So what we do, and we have seen that we have challenges when it comes to immigrants, a big challenge for us. We see that they are less likely to participate, especially in sport. So we are putting extra effort. And again, remember when I say we, I'm talking about the society in general. So putting extra effort, educating mainly parents and the caregivers about the importance of the child participate, because we should never forget that who are the key players in our children's life, parents and caregivers. So educate them. We also see non-binary. You know, that's a group that we have to reach out more, make sure that they feel welcome in the organized activity, maybe especially sport. So it's all about, like I said, analyzing the data, know where you're heading, you know, see what could be done in a different way, but evaluation on what you are doing. You know, if you're asking for lots of money, that you have to show them, like I know that Roskilde will do now, we need more money, see what we have been doing a great job.
So this morning when Minister Forssmed was asking how do we get all children involved in leisure and community activities, what is your answer, Margaret, to that question?
Keep on going, making sure it's funded, you know, make sure that we put money into it, that we are educating the coaches and the trainers, believe in the upstream way work, that's really important. Make sure that we are reaching out to all children, offering them different kinds of things. And we, you know, the municipalities are funding the leisure activities in Iceland and everyone gets the same amount. So we also have the opportunity to add something extra when we have to reach out to groups that are maybe more harder to tackle or just can't afford.
Madeleine, now that you have the task of actually developing a Swedish model, and I know you're full into the work of this, do you have any questions or things that you're really curious to know from either Denmark or Finland or Iceland that could be useful for your work?
Yes, of course, I have many questions, but I'm not...
Some of them we'll take in the break after.
We don't have time to do it all. But one thing was that you both Denmark and Iceland were talking about the municipalities deciding for themselves to fund the leisure card. And I'm wondering, because we were talking about this is not supposed to be about politics, but different municipalities have different amount and challenge regarding to how many people, how many children live in low-income households and so on. So my question to you is there equal opportunities in Denmark and Iceland to engage in the leisure card, depending on where they live?
Absolutely not, of course. You know, we have Reykjavik and the capital area. You can just think and compare it to a village with 2,000 people. Of course, I'm sure that if I was here from the Reykjavik city, I would clearly ask for more funding from the government. So it's not like that. But I think, you know, when you are controlling, when you have the ownership of the leisure card within the municipality, but supporting. And I'm really optimistic, and I'm sure that we will see more money being put into primary upstream prevention, leisure card or other domains of our children's life.
Michael, any considerations? I know that you have managed to secure money from the city council in Roskilde several years in a row, even though there's been quite a restrict budgeting in Danish municipalities in general and also in Roskilde in particular.
Yeah, but you know, I gave them those examples. For instance, this girl, and other examples of how a relatively little effort can save in the long run a lot of money. So the cost of social partnerships is almost the same as a year in prison. So can we prevent? And I have a wonderful story about exactly that. A guy that has said he did not go to prison because of this. Then it pays for itself. So we and all the health expenditures that are so high, if you could take a little of that to prevent people being sick, then we can fund it all. I think.
The sense of belonging, this is what it's all about, and we are going to talk about it throughout the day, you know. Belonging in the community.
Before we round up this conversation, are there any last short pieces of advice for Madeleine and her colleagues developing a Swedish model? Any things that are important to say this should definitely be kept in mind or be done to make sure that the work done in Sweden will be successful as well? Ina?
Well, we tried this kind of leisure card once, nationwide. It didn't work. So we had an excellent best practice from city of Pori. But to make it nationwide, it was actually we struggled in the technical costs because it became so expensive to maintain it, and there was a fee for every municipality, you know, starting from middle-sized municipalities, so they didn't take it. I've been following quite closely this culture passes, what's happening in France, Spain, Italy, many countries already. They put their money for the 18-year-old. And especially many countries, there are a lot of actions now to the age group 18 to 25. But I think it's still coming to the Nordics. And I think we are a little bit behind because there's really a lot of actions for that group. And I'm thinking that do we actually, we put so much effort on the childhood, and then comes this youth, and then before they are able to afford sports and culture and whatever activities the society offers for the adult. So I think we should do something for that age group too. And I think that model where in the card there is money to just go and participate on the equal basis works much better than any other card.
So if I understand you correct, both to have a wide perspective on children and youth, but also to make sure to keep the administrative cost relatively low so that the effect actually goes to the children and youth. Michael, any last
quality? Make sure that you are asking for a quality. Learn from our mistake. You know, of course, you will do that in a way. Quality in strategy, quality that what people are offering to our children or your children is of quality. Educate people who are working in the leisure domain, and that's really important.
And for my advice would be to keep it simple. Not for the municipalities or the administrations, but for the families and for the sports associations. Because in Denmark, at least, most of them are volunteers. So we can't give them a lot of paperwork. So keep it simple. Keep it simple.
That's a very good last word from here. Thank you very much, Madeleine, Ina, Margaret, Ina, Madeleine, and Michael for being with us here and to share some of the insights on the different Nordic models on actually engaging children and youth in a meaningful leisure time. Thank you so much for that.
Thank you.
Thank you.
Now, our four guests up here have also proved the idea behind the conference that both challenges and solution resonates across the Nordic countries, and there's quite a lot we can learn from each other in that regard. And if we work together, we can pave a way to a better, good and equal health for all in the Nordic countries. The next theme that we will confront is the challenges posed by the overwhelming presence of digital devices in our daily lives, particularly for children and youth. So how do we strike a balance between the benefits and the risks of digital media consumption? And as Minister Forssmed were asking us this morning, how can we create a constructive dialogue about how society can support children and young people to have a healthy relationship with digital media? Today we'll examine some of the measures implemented at a national level across the Nordic countries, and both in Denmark, Norway and Sweden, and we'll look at other supportive measures needed to cultivate healthy digital media habits as well. Please continue to use the chat in Zoom, as you know you've been doing all morning. Post questions, comments, please feel free to share relevant material also. The chat will be moderated by Anna from the Nordic Welfare Centre also this afternoon. But without further ado, let's dive back into today's program. And our first speaker up here this afternoon is Jens Christoffersen, who is a senior advisor at the Danish Health Authority. And Jens will give us some introduction to the Danish recommendations on screen use. Welcome, Jens.
Thank you, Morten. Thank you. And thank you for the opportunity to share with you the work that we in Denmark have made on the possible health consequences of the increased screen use among children and young adults. I will start by outlining the frame for the work that we started in 2019. Then I will share with you the recommendations that we made in 2021 and the recommendations that we made in 2023. And I will end my presentation with sharing some of the thoughts of what we're going to work with from here. As I mentioned, we started this work in 2019 with the focus on the increasing use of screen and social media among young children and young adults. We had the resources in corresponding to 1 full-time employee on this focus, and that is still the case. The work had from the beginning 2 tasks. The one to create knowledge in order to make recommendations, and the other to spread the knowledge and the recommendations through reports and campaigns. Our approach was to identify what influence the increased amount of time spent on screen among children could have of a couple of relevant health issues when growing up. And we chose to focus on sleep, physical activity, relations, and stress. And these issues have been explored through literature reviews. We are also curious about what possible neurological consequences the screen use could have, but at the time we assessed that the literature was very small on the subject, so instead we made a work group of neuroscience to discuss this subject. We began by focusing the literature on the 0 to 15 years old children for each of these 4 health themes. And after that, we looked at the 16 to 25 with the same health themes and through also literature reviews. And then we have supplemented this knowledge with a literature review on addiction and a literature review on the relationship between screen use and concentration. After the first round of literature, we formulated recommendations for the small children back in 2021 and followed it up with a campaign focusing on the parents to 1 to 5 years old children and the parents for 6 to 12-year-old children. After the second round, we made recommendations for the whole population. The second round of literature reviews, we made recommendations for the whole population and followed it up with a campaign focusing on the young adults' screen use in relation to their bedtime and sleep habits. Similar for both literature reviews were that the literature did not give us any clear evidence on the connection between screen use and these health issues. The strongest evidence we found in connection to sleep, where we could see that screen time before bedtime would prolong the time to fall asleep and then shorten the sleep length. The recommendations from the Danish Health Authorities concern a family setting and a leisure time setting. But our knowledge is part of the background of recommendations at daycares and school, which other ministries have been worked with and have been announced. Our first recommendations were framed in this campaign family and were narrowed down to 5 recommendations. And on this booklet, it says, make sure your child has other activities during the day than screen. Your child should not use screen before bedtime. And on the other side of the booklet, it says, remember to discuss the rules of screen use in the family and let the rules apply to both the children and the adults. We have a recommendation only to the parents to remind them to reflect on how they use the screen when in presence of a child. And finally, we have recommendations that screen activities can be a social event and can be a shared entertainment and experience for both the adult and the child. Last year, when we finished our second literature review on the 16 to 25 years old, we adjusted the recommendations with an overall aim to be more specific on the children below 2 years of age and to stretch the recommendations to the whole population. And this picture is from the campaign that we launched at the same time, focusing on the young adults' bedtime and sleep habits in connection to screen. And the title of this campaign was Which Monster Disturbs Your Children's Sleep? For everyone, we now have recommendations that no screen before bedtime, no screens in the bedroom. Remember to limit the time spent on screen and to be physically active. And reflect on how the use of social media is affecting you. It is new that we now have recommendations for the whole population, and it is also new that we now ask people to be aware of how social media affect them, which is very individually and therefore very difficult to make specific recommendations about. We still have recommendations towards the parents of children living at home, and there we have gone a bit further concerning the children under the age of 2, where we now recommend no screen use unless it is in active interaction with an adult. We appeal to the parents to have an awareness of how their screen use, how they use the screen in company with a child, and to engage in their children's digital life. And finally, we have a recommendation to make the family agreements on screen use. So there's a huge overlap from these recommendations with the one we have in 2021. But if we look where we have the adjustments, it is of course on the sharpened focus on the children below 2 years of age. On this subject, there has not been sufficient literature on their screen use, so we have focused on the literature that describes the importance of the first 1,000 days and the overall development of the child's health. So this is most of all a precautionary principle in these recommendations. And we find that we can take this precautionary principle because there is no evidence that children in this age are suffering any negative effect on not being on social media or not being entertained by screen. And after reviewing the literature on the 16 to 25 years old, we assessed that there is no specific health issues connected to screen that is significant for a person 25 years old, compared, for instance, with a person of 65 years old. And therefore, many of our recommendations now apply to the whole population. Throughout the entire work with screen recommendations, we have questions about age group time restrictions, together with the other strong argument that it matters what children and young adults see on their screens and not just about the time spent there. When it comes to time restrictions, the literature reviews that we have been made show no clear evidence if 30 minutes is better than 60 minutes on screen, or if an 8-year-old can be twice as much on screen than a 4-year-old. But it is a very important perspective that we still have focus on these time restrictions. We must acknowledge that the social media can cause problems, but there are also positive effects of social media. When we end up with more time-restricted recommendations for children below 2 years of age, it's because we know that it is of great importance the development that the child is going through here with the limited waking hours. Harmful content is also a very difficult area and a very important one. In broad terms, no one should be exposed to anything that is not age appropriate. And if there is harmful content, then you are at risk of seeing it no matter if you are on screen for 50 minutes or for 20 minutes. A harmful content is not just about pictures and videos. So we also have a focus on the contact risk, like when adults initiate activity with a child online, or the conduct risk where the child itself could be the perpetrator by online bullying or by sharing harmful content. But as content on social media is generated very fast and in huge amounts, there lay a great responsibility on the social media themselves to restrict and to clean up the content that is not appropriate for the users of their service. With the new recommendations, we now focus on two important tasks that also reflects our overall mission. The one is to strengthen the implementation of healthy digital habits, our recommendations, and the other is to continuing generating knowledge. As mentioned, there are other ministries that share the growing digitalization of our society as an important subject to be aware of. For instance, we have the Agency of Digital Government that works strategically with the digitalization of our society. We have the whole daycare and school area that I told you about. We have the Ministry of Culture that, among other things, looks at content and algorithms. And we have the Social Authority that also looks at harmful content, and other ministries as well. We find it very important to try to coordinate all these agendas and learning from each other's approaches to the subject in order to strengthen the overall implementation of a healthy digital society. So that will be an important aim for us forward. The same could be said about strengthening the collaboration between the Nordic countries on this subject. Unhealthy consequences of digital use is still a very new scientific subject, and we try all the time to increase our knowledge on the matter. We have already looked at the literature concerning addiction, but we now try to examine it from another angle, where we will see what kind of scientific studies that have been dealt with retaining use and what we know about the consequences of being kept for a long time on games or on social media. Just last week, a Danish study was published showing that addiction to social media is strongly related to developing depression and of being socially isolated. But it's a very difficult subject, and we will need to keep a focus on this as well. Thank you for the attention.
Thank you very much, Jens, for this introduction to the Danish model for screen use recommendations, and also for sharing with us how you've gone from a more friendly family wooden style to a more Hollywood scary movie style in your campaign. Thank you very much for that. As we send you off stage, I'll be introducing our next speaker just in a second. But first, I would like to just mention for you that some of you might have noticed that the Nordic ministers for both health and social affairs actually expressed their concerns about the link between screen time and children and young people's well-being at their gathering here in Stockholm just a few weeks ago. And just as you said, Jens, the ministers asked for more work to be done also on a Nordic level to address how screen time affects the health and well-being of children and youth. So this is indeed a question that will be looked into more deeply at the Nordic level, and also the reason why we are discussing it here today. And please welcome our next speaker up here, Olav Velander, who is a senior advisor at the Norwegian Directorate of Health. Olav, who will be presenting some of the Norwegian recommendations on screen use and the following work with the implementation also of the recommendations. Welcome on stage.
Thank you, Morten, for a nice introduction. The next minutes I will share some experience about the Norwegian screen use and guidelines and some ongoing work. But first, screen use and children is very complex. What are they what are you looking on? How old are they? What are you doing when they are not on screen? Are they active? Do they have friends? How is it going in school? It's important to find a balance here. We live in a digital world and need to be digital, but if you have a lot of screen use, it's maybe you sleep worse. You get it's difficult to be attention, and you are exposed for a lot of things. You have a lot of things that you don't control. So when you are a child, you need to also you're in a golden age for motor development, for both fine and gross motor skills. You can learn about a banana on the screen. You can count bananas, but you can't feel a banana. You have to do other things than the screen. So I think that's important, and we have focused a lot in Norway on the physical activity, maybe more than the sedentary behavior. And then behind the screen, there is a big industry. In the public health work, we have often talked about the food industry, the sugar industry. Maybe we have to talk about the industry a little also that's behind the screens, the softwares, the devices, and the shares, the headphones. It's a huge industry, and the children would like everything, of course. The Norwegian children are quite good, or youth are quite good on social media. If we see on the HBSC studies, we are using the social media through the day a little more than the other Nordic countries. The same study shows that youth are using screen nearly 7 hours a day after school. So that's quite a lot, maybe. Is it too much? Is it too little? Another study, Ungdata, shows that around 50% is using screen after school for more than 4 hours. 1 of 5 is using it 6 hours. This is self-reported data, so that's why it's maybe not, it's the amount is changing. When it's come to social media, around 50% of the 9-year-olds are using social medias, and nearly 100% of the 13 years old are using social media. And then we have the school. Like the most of the Nordic countries, we are using digital tablets in the school, and that's good probably. But in Norway, there also is a discussion about the lunch break, because then they put on the TV and they are sitting and eating their bread in front of the TV. So the screen it's everywhere, and then they are going out playing, of course. I hope, but so the screen is everywhere. So sometimes you maybe can think, is it a living experiment with the children today when we are getting exposed them so much? Often we test things on rats before we test it on people, but here it's of course difficult to do it on animals. That was a little about the screen use. Now the guidelines. Over 10 years ago, there was several countries that published screen guidelines on screen. Finland, Australia, Canada. When Norway published their guidelines in 2014, we didn't mention the screen time in the guidelines, but in some fact sheets we mentioned that screen is one way to reduce the sedentary behavior. And then we have started to develop the new guidelines that we published in 2020, nearly 2 years ago. And we started with the WHO guidelines for those under 5 years old that was published in 2019. Then we had a Norwegian reference group who looked on the hearing document for the WHO guidelines for those over 5 years old. We had a national hearing and we made some adjustments after that. And the 9th of May in 2022, we published the guidelines. But they're based on the WHO guidelines, who said that children that under 2 years old should not use screen. And then for those between 2 and 5 year old, they should use 1 hour a day. Less is better. And these recommendations from WHO are strong, but the evidence is very low, because it's ethically difficult to have research on small children, and that will probably be that in the future also. And then we have the guidelines from 2020 for those over 5 years old. They say that it should be limited, the screen time. So the Norwegian guidelines are that we not should have any, it's not recommended with screen time for those under 2 years old. And then for them, those who are 2 years old, the screen time should be limited to 1 hour a day. Less is better. And we have the same guidelines for those between 6 and 70 years as WHO. We started with 6 years because the children start in school when they're 6 years in Norway. That's because it's a little different from the WHO guidelines. When we have communicated it out, we have said that the screen is a part of the daily life for children. So we have made some fact sheets here, but we focus more on that physical activity is more important than the screen time. So physical activity is important for all the children and youth. In Norway now there is a discussion or interest about where are the children playing? Are they just sitting inside or are they outside? What happens with the brain, with the motor skills when they are sitting a lot and using a lot of screen or sedentary? We see a trend that 9-year-old boys are getting less physical active, and that's objective measured physical activity, and they are sitting more. That's not good. And the Prime Minister said earlier this year that we should reduce the screen time in the school, and there have been a little debate about that. And as a follow-up from that work, the government has appointed a screen use committee who will deliver a report in November where they should get more knowledge about the health, quality of life, learning from children and youth and screen. So it's a collaboration with the Public Health Agency of Sweden. So you can read more about it på skjermbrukutvalget.no if you like. So it's a challenging field, and there is the whole time coming a lot of research on children, health, and screen. So it's difficult and it's complex, as I started with. I think it's good with maybe that we could do some collaboration in Norway together, in the Nordic countries together. What we are going to do in Norway, we will follow up the guidelines. We hope we get some resources to that. There is a discussion about the screen use and learning in school. Some schools are taking away the screens and putting back the books. The Norwegian government has come with a gaming strategy. It's time for gaming. So that's on the other side. And participating in sport and other activities is also focused on. There came an action plan all included last week, so we try to get the more low treasures activities and more people, youth, out to the activities. 1 month ago we published a report in Norway where we have made some estimates on the health gains from physical activity. And there is also a calculator where you can calculate what happens with the health if 100,000 of children and youth are getting physical active. What happens then? We have a high pressure on the hospitals and for the future, and the health costs are rising. So we have to work more preventive. We are now starting also new survey where we get objective measured physical activity and sedentary behavior in children and youth. So we get more knowledge about how the trends are. I think that's important. So maybe there are some areas here where we can collaborate more. I think that would be great. But you have to find the balance, as I started with, between the sedentary behavior and the activity. We have focused more on the activity in Norway. Maybe we have to talk more about the type of the digital use, the frequency, duration, and the context here. What are we doing? So that's important, but it's important that the children are physically active. And now I have a question to you there. When we met here, maybe in 20 years or 10 years, what do you think we are about the work we have done so far when it comes to the research about screen time, actions we have done, guidelines and collaborations? Have we done enough? And what should we do today that we are satisfied in 20 years? Think about that, and if you have any questions, send me email and I will try to answer it afterwards. Thank you very much.
Thank you very much, Olaf, for sharing the Norwegian recommendations, reminding us about physical activity. I think it's quite important that we not only discuss how much we can, or how we can take away the screens, but also how we can put in something else instead. So thank you very much for that. We'll get back to you and some of the questions, and I like the idea of a living experiment. And also, please use the chat. Whatever your thoughts, you might definitely send them to Olaf, but you might also share them with each other in the chat. So thank you so much. And now, after listening to the experiences and recommendations from Denmark and Norway, we turn to Sweden, where there's an ongoing debate about the need for recommendations on screen time and healthy digital use among children. And I can now welcome Helena Fridlingsdorf and Sarah Fritzl from the Public Health Agency of Sweden, who will introduce a government task regarding digital media use and how the Swedish authorities are now developing a Swedish model in dialogue with children and youth, and as we hear, also in a collaboration with Norway. So welcome.
Thank you, and so exciting to be here. Such interesting talks from everyone, so really thankful for that. My name is Sarah Fritzl.
And I'm Helena Fridlingsdorf.
Yes, and I will start with telling you the title of this presentation is called "Is there a need for recommendations for healthy digital media use among children in Sweden?" And this is the outline of our presentation. We will talk a little bit about the Commission, the aim we have, and the methods. And then we want to talk about what do children say? What do parents say? What does research say? And finally, what are our next steps? So this is the timeline for our Commission. In June, we will deliver a report where we compile the knowledge about associations between digital media use and health among children and adolescents. And that's for ages 0 to 25. And this is what we will share some results from with you today. And then in September, we will deliver recommendations for the ages 0 to 18. In December then, we will have guidelines for implementation of recommendations. And then the following year will be used for disseminating the knowledge and also the guidelines. Okay, so what are digital media? We talk about this thing all the time, but just to really show you what we will talk about here in our presentation. So these are some examples of use of digital media, and it's basically everything transmitted through internet or computer networks, and that you can see on a device. So it's messages, it's social media, it's communication platforms, or applications, all of those things. And what we focus on in our Commission is the use on leisure time. So it doesn't include digital tools in school, internet treatment and support, or welfare technology. So please keep that in mind as we go along. To analyze this and to compile the knowledge, we use a triangulation of methods. And what we want to focus on here today are those who we have sort of marked here. It's the dialogue groups that we have with the youth reference group. We're very proud of that group. It's 8 young people, ages 15 to 16, which we will meet again this evening, actually. And where we talk about the Commission and we talk about our results, and we get their perspective on what they think about our findings, so that we don't have to guess, but we actually ask them what they do think. We also have child focus groups. We have conducted with, I think, about 200 children now. So it's from preschool and up to upper secondary school. So it's a lot of children, and what we ask them is, what are the good things, what are the bad things about digital media? What kind of support would you need from the adult world? And the same questions we also ask to the parents, but also then what kind of recommendations would you like? What support would you like? What rules do you have at home, and so on. So I think it was really interesting today to hear also Katrin talk about that you need to have a public support if you're going to introduce guidelines or recommendations. And this, we think, by talking to young people and to their parents, this is how we try to secure this, that we actually have a public support, and also to have the child perspective in focus. Otherwise, we know that the recommendations we're going to land in will not be used. So we also have dialogue with authorities, of course, professional groups and civil society. Youth organizations are an important group also. We have an expert group connected also to this commission, and it's 20 researchers who have ongoing research within this area. The literature review, the results from this, Elena will tell you more about in a little bit. We use national survey data also, because we want to have sort of a baseline of what does the picture look like when it comes to digital media use and the associations with health among different groups of young people and children. And also so we can follow up later on. Yeah. And you've heard already that we have a collaboration with Norway and Denmark, and we're really pleased about that, and this will be ongoing throughout the whole commission. So let's talk about what the children say. This is a quote from one of the focus groups that we had. It's a youth in 9th grade who says, "Yes, I talk to my friends who don't live here, like often, and that makes me feel good. But sometimes you get stuck for a really long time on like Instagram and TikTok and stuff, and then it feels, you get restless after a while." And as it has been mentioned also in the previous presentations, digital media is a very obvious part of children's lives today. So what they think is positive about digital media is that it's good for learning things, it's good for entertainment. It's so easy now to find information. If you want to know something, you have everything in your phone, for example. You can look it up so easily. And it's also good if you want to socialize with your friends, arrange a meeting, or just chat with them online. And you can have also contact with people all over the world. So for those who are more limited in their daily lives, this could be a chance of having friends. So it's a source of connectedness and of support. So there are many positive sides to digital media. And of course there are negative sides also. And if the positive sides were quite similar across the age groups that we interviewed, the negative were more diverse in different age groups. But all age groups talk about that it's easy to get stuck. You become more sedentary and you may have difficulties to do the things that you want to do because time runs out, or you missed the bus, or you didn't do your homework, or you got to bed too late, and so on. And when we talk to the older children, they also talk to, or they discuss the exposure to threats and to hate, and that this sort of seeps into their lives also, so things can spill over from school and into their phone at home and so on, and digital media. So it's very interconnected. They also talk about exposure to impossible ideals. So if you have influencers that you follow, or you see these photoshopped images, they impact you, and they can make you feel that your own life is not worth so much, and that your looks also are wrong. And also that it impacts on their sleep, that you get to bed too late, or that perhaps you have notices that you hear in the night, so you wake up and so on. But what do they want then? And I thought also this was very nice with Jens also brought up that in Denmark you say you should discuss with your children, discuss in the family what kind of rules you should have, and this, the children want this also. They want to talk about the screen time use. Many parents just take the phones. They think that's not a good solution. They take away a big part of their life. It's really scary when they do that, so talk to them instead. They have different views on recommendations. Many young people say that, well, maybe this is not for me, I don't need the recommendations, but those who are doing poorly in school, they could benefit from those, and many others could. So there are different views, but what they all want is more knowledge. What is harmful? What is a good app, for example? And where can I turn to if I need more information, or if I want support, if I feel someone is being harassed, how can I report this? Where should I turn? Or if I feel that I use too much digital media, where should I turn? So this they do want. What about the parents then? Well, this is one quote from a parent with a teenager with disability. For these focus groups, we interviewed parents from with children in different age groups, but also parents of children with disability or with a psychiatric illness, or who were foreign-born. So this is a quote from a parent of a teenager with disability. Tell the gaming developers to stop making games that never end, that the children cannot even take a break for food without being thrown out, which is their biggest fear. So the positive things, we asked both the parents and the children the same themes. So one was what is positive, and they say almost the same thing as the children do. It's good for learning things, it's entertaining, it can be a distraction, you can keep contact with your family, especially if you have family living abroad, you can be social with friends, it's fun to game with friends and so on. And for parents it's also a break, sometimes the only break they get. So many positive things. The negative things, also these quite echo what the children say as well. Parents are worried that it's addictive and that it can make children very passive. Some say also it can give a distorted view of reality. When they see this, they think they can be influencers or YouTubers, and they can have tons of cars or lots of toys, and they worry about what that will do to their maybe their stamina and so on. And it's a source of conflict. If you want your kids to come and eat or go to bed, and you have a conflict with screen time there. And also, as we heard from Norway, also that both researchers and doctors can be concerned about, parents are also concerned, how may digital media affect the health and the brains of younger children. And what do they want? When we ask them about what kind of support they want and what kind of recommendations they want, we hear that parents of younger children are more positive. And there's also a desire to learn more about hazards. What is harmful? What is actually harmful? And they want to know this so they can use this in their discussions with the children and also in setting limits. And they also want to know where to turn for support, especially if they feel that their children are becoming addicted. And they also are very clear that recommendations must be built on facts and to explain the consequences of problematic media use. Right. I hand over to you, Helena.
Okay, thank you, Sarah. So what does the research say? Of course, it's fantastic to have your upcoming recommendations well anchored with the end users or the target groups, but they also need to, of course, be based on the best available science or scientific evidence. So we have done, during this past year, extensive literature searches and extensive literature reviews, and some of them are mentioned here. So the main question is, of course, how digital media affects physical and mental health. And that includes cognitive development, sexual health. We take a very broad perspective. And we also look at sleep, physical activity, social relations, the risks for becoming addictive or getting problematic use of digital media. We also look at whether digital media affect different groups differentially. For example, different socioeconomic groups, minority groups, children with different types of disabilities, like Sarah mentioned. And we also look at how the design of the platforms, like how different types of interaction design and algorithms affect the use and also the health of children and youth. And last but not least, we also look at how parents' own digital media use in front of the children can affect children's development, attachment, and we also know that most children don't do as adults say, they do as we do, so we also have a responsibility here. And when we're looking at the digital media, we also take into account everything from screen time to type of content, to which type of digital media. Is it social media? Is it gaming? So many big questions. And today I'm just going to show you some highlights. So body image and sleep. So you can see this as a little teaser as of what is to come in June. Then we will be able to give you a much fuller picture. So sleep is one of the areas where we have found really robust results, like Jens from Denmark also mentioned. So here we can say that we actually see that high screen time is associated with sleeping problems. And it's most pronounced for sleep duration, but also for the quality, like how many times do you wake up during the night, for example. And we have seen longitudinal studies and randomized control intervention studies in all of these age groups and in large reviews of the literature. So that says something about the direction of the association. Of course, if you have sleeping problem, that can also lead to increased screen use during the night. But here we can clearly say that there's a causal relationship between use of digital media and sleeping problems. We also see that problematic use, which is defined as if you have signs of addiction, for example, that you're trying to decrease the screen time but not able to, that has a higher impact than screen time itself. And also, like in Denmark, we've seen that digital media use in the evening and, of course, also during the night affects the time to fall asleep and the sleep length. And in addition to that, we know that the effects on mental health are mediated through sleeping problems. And sleep is, of course, super important for mental and physical health, school achievement, and well-being in general. We have also seen evidence that social media can affect body image. So what we see is that exposure to beauty ideals and body image can lead to a more negative body perception in the ages 9 to 18. And also here we have longitudinal studies which implicate that there's a causation. And when we look at body positive images, there have been some varied results, so we can't say that much about that. We have also seen that there's an association between social media and actual eating disorders. And of course, not everyone who's exposed to social media gets an eating disorder. So there are also genetic and other psychological factors at play, such as self-esteem, anxiety, and body image itself mediates this association. Okay, so just to summarize these preliminary results from the literature review. So first of all, digital media have both positive and negative effects on children's health and well-being. And we've also seen that digital media is associated with impaired sleep, negative body image, and an increased risk for eating disorders. Another thing that I can also mention is that we've seen that the commercial digital media platforms have many features that are designed and that do stimulate increased use. And we've also identified some knowledge gaps where more research is needed, above all on how equality, like for example, different socioeconomic status, how does that affect the digital media use effects on different health outcomes. We also need to do more research on different age groups to see what the differences are there, and we also see a need for collaborations between researchers, independent researchers, and tech companies. And now I would just like to sum up the preliminary results of the entire knowledge compilation and answer our question. Yes, recommendations are needed. And again, I can't say this, emphasize this enough. Digital media have positive and negative effects. So the challenge here is to, as we have mentioned many times today, is to find a way of keeping the beneficial things and reducing the harmful stuff. And it's also become very evident that both children and parents highlight that digital media are or can be addictive. And many children and youth report that they use digital media more than they would like to. So they definitely need support and help with that. And statistics, panels, and research all indicate a negative effect on sleep. And there is also then a big need to identify and prevent problematic use. Across all these research questions, we see that the strongest effects of digital media is if you have a problematic use, not necessarily the screen time in itself. And then we also need to take a holistic approach. A key word that has been that we've heard many times today is balance. So we need to find the balance and strengthen the opportunities to get enough sleep, physical activity, and other health-promoting activities. And finally, I just wanted to show you how we work from knowledge compilation to recommendations. So this past year, as Sarah told you everything about, we've had child panels, parent panels, dialogues with a lot of different stakeholders. We've looked at the statistics, the research reviews, and ideally, such as is the case with sleep, we see that all these speak in the same direction, which is very, like if it's anchored with the target group, the recommendations are much more likely to be implemented and lived. And our next step then, so this will be delivered in June, and we're already now starting to develop these recommendations that we will deliver in September. So already tonight, we will speak with our youth reference group and show them the same results that we have shown you today, and see like, hey, what do you think about this? Did we miss any important perspectives? And what do you think, what would be a helpful recommendation or guideline to get better sleep or to remove the barriers to get a more balanced use of digital media? We have internal discussions at the Public Health Agency with all the different units that have developed recommendations in the past, for example, for physical activity. And we also talk with our focal points for culture and behavioral insights. And a super important step is also to get input from other countries, like Denmark and Norway, that we already have collaborations with, WHO, to get some tips and recommendations. How do we develop good guidelines and recommendations that will lead to an effect, basically? We will also have discussions with our expert group and hearings with other experts and stakeholders to make sure that this is that the recommendations and guidelines will be as useful and effective as possible. So we look forward to more Nordic collaborations, and anyone who's interested in collaborating, feel free to contact us. Thank you very much.
Well, thank you very much, Helena and Sarah. We'll get back to you, Helena, in a little second, together with your colleagues from both Denmark and Norway. But first, I'll go over here, because we've now listened to government perspectives from 3 different Nordic countries. But what about the youth from in the Nordics? What are their perspectives on the impact of digital media use and the need for recommendations on this regard? And to help me answer some of these questions, I can now welcome Andreas Salomonsen from the Nordic Youth Council. I think if we can just change the slide to the next one, then there will be also a presentation of Andreas. Thank you very much. And even And thank you, Andreas, for helping us reduce the average age in the studio a little bit. Even though you're not that young, you will still help us as one of the Nordic youth representatives. And I'm curious first to learn, just out of like personal experience, how do you personally navigate screen time and screen use, digital media use in your daily life?
Yeah, well, I mean, I use my screens a lot. I mean, basically, my studies are on the screen, on my social contacts, political contacts. I also enjoy, like, my hobbies are gaming, so I use the screen. So for me, it's more about what I do when I don't use the screen, rather than how much I use it, because I know that I'm going to use it. So for me, it's more about, like, being sure to bicycle every day when I possibly can, take the longer route to the convenience store. I mean, try to compensate in that way, because at least for me, I know that I can't really reduce so much of my screen time if I still want to do what I want to do. So that is more from a personal opinion.
So the word of balance also resonates with you. If we move on to challenges and concerns, I'm curious to hear, like, based on your experiences, also like from people at your study and other things, what challenges do you see that children and youth are that they face in managing the use of screens and digital media in their everyday lives?
Yeah, I think a big part of it is, of course, to be able to, as we said, take a break. Because as we see these companies like TikTok or Google or YouTube, everybody, they design their social medias, for example, to be as addictive as possible. So the algorithms will recommend things that make you watch more and stay on longer. And I think that we really, I mean, that's an important part. We need to see that we need to regulate this more, actually, because people need support, because everybody can't really take a break. I mean, some people sit on what we, like in our generation, call doom scrolling. It's like when you sit forever and you just scroll through more social media posts or more content. So I think a big part of that is to like how to manage breaks and how we actually go from doing something that we find fun and entertaining, but to doing something other, like studying or going out for a run. Because those are the things that we have now become so used to be able to use these devices a lot, and it's going down in the ages as well. So we need better methods, and I'm not exactly how we should do it, but we need to be able to have a good way to switch from.
So going back to also what Katrina said earlier today, that it's very hard as an individual to step out of the media use, because also, as you say, there's so many things around us that encourages the screen use. So basically, you agree that there need to be some kind of regulations or other structural measures to basically help cut down on the screen use. And I guess that also doom scrolling, I've heard, has been now even discussed in the European Parliament as part of the upcoming election. How can we basically set up regulations that might reduce this a bit? But another thing that I'd like to hear your opinions on is that there is a lot of focus also today on the concerns regarding screen use and digital media use. And then now both Helena and Sarah also mentioned that there are obviously benefits and opportunities also that should not be overlooked. Do you see that there's the balance, or like a wrong balance, that the positive elements are in some way overlooked and we discuss that too much, that the concerns instead of focusing also on the benefits?
Yeah, absolutely. I think there's something in what you're saying, but I also think it's about how you use your screen time as well. I mean, for example, you can use your screen time for just doom scrolling, or you can use it for talking to people. You can use it for reading and learning. And for example, I spent maybe all of my teens in front of a computer, but I learned a lot about IT. And now I've been able to actually partly work as a consultant in IT, which has been like really good for me. So I think it's also about how you use it, and we need to understand that some people who maybe are socially isolated in like the real world might actually have their whole social community online, and people are actually developing themselves. And especially for youth, when it might be hard to fit in, for example, you might find an online community that supports you. And I think we need also to think a lot about the very diverse things you use your devices for in screen time and how you interact in a very diverse way. And it's as diverse as people are. Absolutely, many people do use social media and just doom scroll, but many people use it for so many other things. And that, I think, is partly overlooked.
If we then move on and look at some of the screen time recommendations or screen recommendations that has been mentioned here today, both in Denmark and Norway, and then the upcoming recommendations in Sweden. Now, listening to these presentations, what are your general thoughts on the different screen time recommendations for children and youth and how they've been presented today?
Yeah, I absolutely think, and I think many youths, especially those who are around my age, were born 2000 and a bit later. We partly grew up with the screens, but we didn't fully grow up with them, because those who are born today and after 2010, they basically grow up and they start with a screen from day one. So I think that's a different thing, and we, at least people in my age who are turning more as young adults, we realize that this is not really especially good, especially for the small children. So I think that me personally, I think a lot in my age would also agree that for children and smaller kids, the minimum amount of screen time is good, because when you get older, your screen time increases, as I've said, because you have your friends, you have your other connections, you have school and you have work, and so on. So I think that's really important to consider. But I also think that these screen recommendations, they partly focus, in some cases, on one thing. They are the experts, of course. I don't have a PhD, but
not yet, at least.
No, exactly, not yet, at least. But it feels like it's quite a binary thinking, and you're more saying that you shouldn't be at the screen. But why shouldn't you be at the screen? Why do you need to reduce it? And that you kind of forget in these recommendations always to make people understand why. And that, I think that youth and children don't like to be told what to do, but if they understand why in a better sense, I think that would be a good point.
And that moves on to my next questions, which is basically not so much about the screen time recommendations, but more on the communication side of them. What are your thoughts and views on how they should be communicated in a way that makes them relevant for children and youth?
I think that partly to actually make sure to maybe advertise about the screen times actually in that cases where youth are using their screens. So if I scroll on Instagram, for example, then if there comes up actually an ad that is about screen time, that could be a good way of implementing it. And also making sure that even if it's good to use school outreach, but especially during a certain age, as we said, children and teenagers don't like to be told, but to make sure that we use, the civil societies and different forums to actually make sure that these recommendations are communicated well. For example, if there is a big, gaming event, communicate it there. Don't make it more as like, I'm an adult, I'm telling you what to do. But as I said before, make it more about them understanding why they actually need to reduce their screen time, and communicate it in that way instead of more like, this is what you should do and what you should not do.
Now, you also listened to the recommendation and seen them. Do you have any suggestions for improvements? How could they be even better, or be more relevant, or be used more, perhaps even?
Yeah, I think I partly touched on that, but and also with the fact that people use their screens for many things. But I think that the screen time recommendations can also be made better if you actually find some good model for different models for teachers or people in civil society and parents to have like a straightforward way to communicate this in a maybe non-normative way, where it's more about what is actually screen time, what are you using it for, and what are some negatives and positives, rather than talk just about you're sitting at the screen and it's damaging your health, but why is it, and what can you do otherwise, and especially to have options as well. What are some good options to screen time?
So not just take away the screen, but actually introducing other things that are relevant and fun.
Exactly. And partly, is there things that you can do with your screen that you can combine with physical activity, but also just in regular small tips, even for those who use the screen a lot, like I do. I probably wouldn't take down my screen time especially much, even if I know it's bad for me with a lot of screen time, but what are the small things I can do in order to make it better?
Thank you very much, Andreas. We'll continue our conversation together also with the previous speakers in a second. But first, I would like to show you another short film with some young voices and their views on screen time and digital media use, again done by the Nordic Welfare Centre. It's shown here.
När man säger digitala medier så tänker jag på appar som Snapchat, Instagram och TikTok.
TikTok, Insta, Facebook, Snapchat.
Om du säger digitala medier så tänker jag väl på kanske tidning på nätet.
Jag tänker direkt på sociala medier, men det kanske inte är samma sak. Ja, men de sociala medier jag använder det är mycket Snapchat, TikTok, inte så mycket Instagram, men lite Instagram.
TikTok, Snapchat, YouTube, mest dem.
Men jag använder typ Pinterest, Snapchat och TikTok mest.
Jag tycker att det borde finnas lite regler i alla fall för barn som är lite yngre, för att det kan ju påverka dem jättemycket och de kanske blir så beroende så de slutar idrotta.
Ja, men jag tycker nog att det borde finnas en åldersgräns för sociala medier, för att det kan verkligen påverka unga.
På ett sätt kan jag tycka att det borde finnas en åldersgräns, eftersom att det är många som blir både påverkade men också utsatta för olika både lurendrejerier. När man kanske är yngre så är det inte så lätt att förstå när det är någon liksom, som talar sanning eller inte. Så då borde det finnas någon typ av åldersgräns som kanske inte begränsar all typ av sociala medier, men i alla fall sätter någon typ av riktlinjer.
Jag tycker det borde finnas regler för vuxna användare. Inte vara på telefonen för mycket för att vara med sina barn.
I'm joined here on the screen with a very strong panel with Jens from the Danish Health Authority, Helena from the Public Health Agency of Sweden, Andreas again from the Nordic Youth Council, and Olof from the Norwegian Directorate of Health. And to start out our conversation up here, I'm curious to hear your reflections on Minister Forssmed's question this morning. Olof, if I turn to you, how do you see that we can create a constructive dialogue about how society can support children and youth to have a healthy relationship with digital media?
I think, as I said before, I think dialogue with the industry is important, and maybe also across the sectors in the government, and a dialogue with the children, of course, and youth is important. I think maybe that are three important things.
Andreas, you touched upon it before as well, but if we take it in like the way the minister posed the question, how do you say that society in general can support children and youth to have a more healthy relationship to both screen and digital media?
I think that we need to have a better starting position. So when we come into social media as young adults or youth or children, we don't have a strong starting position because many are not fully developed, they don't understand everything. So I think that we also need to regulate how these tech giants actually make social media into something that you can become addicted to, and also what content it shows. So I think that's a big part of it, in order to make sure that our children and youths have the best options when it comes to how they consume it in a more healthy way.
Mm. Helena, if we move to the more specific screen time recommendations, one thing is the recommendation, another thing is basically creating awareness and actual use of the recommendations. What are your thoughts on which strategies should be in place to both ensure awareness and actual use and following of these guidelines that you're now developing in Sweden and that we already have in both Sweden and Norway?
Yeah, that's part of the challenge that we have ahead of us to look into the best arenas, the best ways of reducing barriers, etc. And I also think that we have, like speaking of society, that the responsibility lies on many different levels. So if we want to be at the forefront of digitalization, which the Nordic countries are, we also have to be at the forefront of the knowledge base on when it is good for public health and when it's not. So we'll definitely try to make recommendations for politicians, for tech companies, for schools when it comes to educating on a healthy and balanced screen use.
So to make it easier for different actors to actually act upon the recommendations that are being made.
Right. And it's difficult to say more since we haven't developed the recommendations yet.
But Jens, you have we have the recommendations in Denmark. What do you do as the Public Health Authority in Denmark to make sure that the recommendations are not just sitting there on the digital shelf, but is actually being used?
Yeah, and that's a very good question, and it's not easy. As we heard from WHO earlier today, doing the recommendations as campaigns will not change behavior. But we see that our campaigns are a way of keeping the debate alive, and of course also have some awareness of what to be concerned about, or but to support these campaigns, we need to go more structurally to it. There's no doubt about that, and we hope that we can gather the different agendas and the different ways to work with this subject across the different sectors and the different authorities. So in one way that we can coordinate and support on many levels for a more healthy digitalization. That's not easy because this agenda is many different perspectives in it. We have the well-being perspective and young. We have the commercial interests from big companies. We have the AI perspective. Somehow they are woven together, but we also need to find out how to support the different aspects also.
And a following question, perhaps both to you and to all of us as well. Andreas has suggested several ways to communicate this, to do it on the platforms that they use, that young people are actually using, or events that are actually centered around a screen, to basically to communicate it in a perhaps more relevant way. Does that resonate with the way that you normally do campaigns, or is it something that you could take into consideration?
We do campaigns in a lot of different ways, so we have some experience into that also. But as Andreas spoke, I also get inspired that we are trying to show the young people in some of our campaigns what to do. But what we actually want to is to speak to the parents, and they play a very big part of this. And we have not yet managed to support the parents enough on this issue.
Well, how does this resonate with how you communicate in Norway? How you work to not just have your recommendations sitting there on the digital shelf?
We haven't communicated the recommendations so much, but when we published it, it was most of interest was for the smallest children under 2 years, if they should have a screen or not. That was the most interesting, and we didn't thought that should be so interesting. But maybe we should have to do something like in the traffic. We have over 50 years in the Nordic countries and in the world made some driving rules. Maybe we have to think a little like that in the some digital parental driving rules or something like that. How we should follow it up, and it's
I'd like to talk to you about a related issue, of course, because the discussion of screen times and digital media use, it's a pretty hot topic in most of the Western world, at least. And recently, the American psychologist and professor at New York University, Jonathan Haidt, published a book called The Anxious Generation, which has received quite a lot of attention. And in this book, Professor Haidt proposes 4 fairly simple social norms that can be implemented by both parents, by schools, but also by local governments. And what he says very simply is no smartphone before high school, just give kids a simple flip phone, no social media before the age of 16, phone-free schools, and more free play and responsibility in the physical world. What do you think of these kinds of recommendations? They're pretty simple, but they're also quite strict, perhaps, at least considering how we often do it. What do you think of these kind of recommendations? Helena?
First of all, we totally agree with John Haidt that more free play and outdoor activity, that would be great. We definitely know that from a big body of science. And when it comes to phone-free schools, most of the schools in Sweden are already phone-free because they notice that children work better. So the next one was no smartphone before high school. And we, from our literature reviews, we can't answer to whether that's beneficial or not. That maybe depends a little bit on what society looks like. If you have to find maps or the ticket to the bus, or even the leisure card might be in the phone. So
it might be hard actually to realize.
Right. And we also know that a lot of children have benefits from communicating and chatting with each other. So that's not so simple.
But then there's the no social media before the age of 16. I mean, age barriers to social media is a big debate also in the European Parliament and globally. We know that there are age limits on many social medias. Then we also know that many people find ways to go around them, either with the help of their parents or with the help of somebody else. What do you think about these kind of recommendations? Should we be more strict on social media and when to introduce them, Andreas?
Yeah, as I said before, I think it's more of an issue about the person who's using them and what kind of situation and what challenges they have. Because if a person is 16, they can still consume social media in a much more healthy way than a 55-year-old could. So I think partly there, and also because it's so widespread, and I'm not sure that anybody would try to block social media in ways that they do in dictatorships, but for certain ages, it's kind of extreme. So we have to, I think we still need to reflect more on what are the actual bad things that we're trying to prevent by setting these things, and instead of working on that, because we will be using social media still, and some people will not be able to use it in a healthy way.
So if we then move the question a bit more broadly, how do you see that we can more generally empower children and youth to make informed choices on a healthy digital behavior on screens, on social media? What can we do, like other supportive measures around recommendations to actually do as you say, Andreas, and actually help those who need it to develop more healthy habits? What can be done, Jens?
I'm a bit skeptical if we should lay that responsibility on the young children to make informed decisions. So I think that we need to support them at least, and also as WHO mentioned earlier today, there is a culture, and that culture is also generating behavior. And we know there are a lot of children and young adults who have a hard time leaving the social media because there is some kind of their friends count on them to be there, and they know that everything in their social life will be conducted on the social media, so they have to stay online. So we need to make a better structure around the young children, so they do not get exposed to the social media as much as they do today, probably. Some of that could be with age restrictions. I think that there's a lot of content that is not appropriate for all ages on these medias. So maybe we should try to look that way. Some could be like reducing the social media at school and in some leisure time also. And hopefully also with the parents' help to maybe reduce having access to social media at a certain time of the day where all the classmates don't have their phone.
Helena, one last theme that I would like to touch upon that you also touched upon in your presentation is that I guess it's no secret that screen time also has a social gradient, and research indicates at least that parents with longer educations are better at managing their children's screen time. How do you see that we can address social inequity in health also when it comes to the use of screen?
Well, first I think it's important to remember that from a social medicine, public health perspective, the best way is to decrease the socioeconomic disparities and thereby the health disparities, so that we don't forget that. And the second best is to compensate and increase access to, healthy screen use and digital media use and all the recommendations and guidelines that we will develop. So reaching those who need it the most, that's at the top of our minds, and we're constantly working to find ways.
Olaf, any thoughts on the social gradient and what to be done there when it comes to screen?
It's difficult, I think, but we are, as said before, I think the activity to make it easier to young children to be active. A price is high to participate in sports and other activities in Norway, so try to make it easier to join the local team. Then it's cheaper to buy a tablet or a new phone than to join the activities, and that's maybe not so good.
So make it easier to make the right or the healthy choice, and basically to not just take away the phone, but also introduce different things into children's life. Thank you so much, all of you, for sharing good insights, and great to hear that there's already a lot of collaboration between the Nordic countries when it comes to screening regulations. And then I guess that all of us will also be able to see that in the upcoming elections in the for the European Parliament, that this is already becoming a fairly hot political topic. There's already been suggestions, so this might be something to follow also in this regard. The final theme that we will confront today is the issue of loneliness and social isolation, which echoes across our Nordic societies. We'll be looking at what preventive measures can be used to cultivate stronger social connections and foster a sense of belonging within our communities, as well as Minister Forssmed's question from this morning: what role can society play when it comes to combating loneliness and social isolation? And to help us set the scene, we'll now be joined by Hillevi Busch, who is a senior analyst at the Public Health Agency in Sweden. Hillevi will help us map the challenges based on a new report done by the Public Health Agency here in Sweden, but will also tell us a little bit more about how Sweden is developing a strategy to reduce loneliness and social isolation. Hillevi, please welcome up here on stage.
Okay, thank you very much, Morten, and I'm very happy to be here today to talk about our work on developing a national strategy to reducing loneliness in Sweden. Yes. In April last year, we got an assignment from the Swedish government to propose a national strategy to reduce loneliness. And this assignment is part of a larger governmental program to combat loneliness. During a few years, a lot of money is given to regions, municipalities, and the civil society for activities, mainly, but not only, directed towards older age groups. The governmental assignment is divided into two parts, and the first step is a situation analysis of loneliness and its prevalence, consequences, and the measures already taken in Sweden to reduce loneliness. This situation analysis was published in March this year, and based on the findings of the situation analysis, we are to develop a national strategy. The importance of joint action is highlighted in the assignment. Hence, our job now is to propose how the government and the agencies can work to reduce loneliness, and also how the regions, municipalities, the civil society, and also the enterprise can contribute in that work. and the proposal of the national strategy will be presented the 1st of February next year, so we don't have really much time. All right, we have all experienced loneliness from time to time, but what is loneliness actually? According to research, loneliness is an unpleasant experience that occurs when a person's network or social relationship is deficient in some important way, either quantitatively or qualitatively. And loneliness comes in 3 different forms. We have social loneliness, which is a lack of people to interact with regularly. We have emotional loneliness, which is a lack of meaningful relationship or someone to confide in. The existential loneliness is a deep feeling of being disconnected from the world. Here's the outline of our work. Research is the base of our work, and we used systematic reviews to gain knowledge in the field of loneliness. Empirical data we used to get an accurate picture of loneliness in different groups of the Swedish population. And the practice part is finding out what has already been done in Sweden and hopefully find some good examples. Finally, we review strategies and work of other countries, also to gain information about how a strategy can be developed. And we also collaborate with the National Board of Health and Welfare in Sweden. So, how common is loneliness in Sweden? Actually, the prevalence is very dependent on what aspect is being measured. Hence, depending on measure, loneliness may vary from 3 to 41%. I will tell you a bit more about this. When it comes to single households, we can see that 41% of all households in Sweden consists of only one person. And as you can see in the figure, the rate increased by age. Thus, the highest rate is found among the oldest age groups, where 60 to 80% of the households consist of only one person. And of course, living alone is not the same as feeling lonely, but we also know that there is a strong correlation. 23% of the Swedish population report milder forms of loneliness, and the rates are highest among the youngest and the oldest adults. The difference between the sexes is small, except for in older age, where more women than men report loneliness. Having no close friend and no one to confide in is recognized as emotional loneliness. And this is a distinct form of loneliness, which is also more common in men than in women, at least in Sweden, and especially among younger men. 3% of the Swedish population report severe loneliness, but as you can see, there is a large difference between groups depending on employment status. Men and women who are unemployed or on long-term sick leave report severe loneliness much more often than those who are working. We can also see that people with disabilities report more loneliness than others. More often, they live alone, feel lonely, and report having no close friend. So to summarize, the risk factors for loneliness found in empirical data, but it's also supported by research, is living alone, being young or old, being outside the labor market, having health problems or disability. A finding of the situation analysis is that most research and empirical data on loneliness is on older people, But as Karin showed in the introduction earlier, loneliness is also common in children, especially in teenagers. So loneliness is more often reported in girls than boys, and we can also see that it's more often reported in children who do not identify themselves as being neither a girl nor a boy. Another important aspect is economy, as you see in the figure. Here we can see children divided on self-rated socioeconomic status. And we can see that children reporting having a low family income have much higher, experience much higher loneliness. And this is children reporting feeling lonely always. All right. In our literature search, we found that most systematic reviews are on old people. It's about 38%, and only 18% were on children or adolescents. However, the risk factors for loneliness seem to be pretty much the same as for adults. It's about, for instance, having health problems or disabilities, going through some life transitions, often natural life transitions, experiencing negative life events, and also coping strategies. So, what is being done in Sweden to reduce loneliness? We have found that there are many activities going on to reduce loneliness in Sweden. And most activities are directed towards older people. And for children and adolescents, the municipalities and the civil societies are doing a lot when it comes to promotion, like organizing sports and cultural activities. But we can see also that there are less activities with the specific goal of reducing loneliness in young people. Excuse me. Yes, sorry. The civil society plays a crucial role in reducing loneliness. And the flower in the picture shows our categorization of their activities. And the most common measure taken to reduce loneliness are creating meeting places and social activities. It's about 80% of all measures taken. All right. In the situation analysis, we highlight some challenges as well. So when it comes to research, it is a problem that most studies are on older people. So we do not have so much knowledge on loneliness of children and adolescents. And often there's no distinction between different forms of loneliness in the scientific studies. And this also makes it difficult to evaluate interventions. For empirical data, it is a challenge of how to measure loneliness. And which measure gives the most accurate picture of loneliness. We can also see a challenge in measuring the existential loneliness. Challenges for practice. We can see that there is a strong focus on social loneliness, and we can also see that some groups do not have the same access to meeting places and social activities. It might be due to disabilities or health problems, for instance. But for people who have been lonely for a long time, it's also a big step to go to a new meeting place. A very true challenge is also how to reach the hard-to-reach groups. So the challenge for us now is how to create some joint action to reduce loneliness. As stated by the Minister of Social Affairs, loneliness is a societal problem and it must be solved in coordination between different agents of the society. So how can the various agents contribute? That is something that we are working on today. Not today. We are working on it, and we will present that in the strategy. But here are some examples. We can see that the standpoint of the government is crucial to legitimate the importance of the problem and also give mandate for others to work with this issue. The agencies can work to raise awareness and knowledge of loneliness and its consequences. The regions and municipalities can work to develop more inclusive societies. The civil society by offering meeting places that are accessible for all and individual support. The enterprise sector can also contribute, for instance, by innovative social solutions. Finally, we believe that if we stick together, the whole society, we may actually reduce loneliness and create social connectedness in Sweden. Thank you.
Thank you very much, Hillevi. You will join us again shortly in the final conversation, but first I would like to send you off the stage and introduce our next speaker. So thank you very much.
Thank you.
Because often when speaking about the Nordic welfare societies, a large focus is put on the government initiatives and actions done by both national, regional and local level of authorities or municipalities. But also non-governmental organizations play a significant role within the Nordic welfare societies, not least when it comes to combating loneliness and social isolation, as Hillevi also touched upon. And to tell us more about this, it's my pleasure to welcome Guri Itsuvikan, who's a senior political advisor at Frivillighed Norge. So welcome, Guri. The stage is yours.
Thank you so much, and thank you for inviting me. Loneliness is something we've thought about a lot in Frivillighed Norge. We are an umbrella that represents about 370 NGOs or voluntary organizations in Norway, which in turn represent around 50,000 local chapters. We are consensus-based, and our members, they disagree on a lot, but they agree on the need for more civic space. And I'm pretty sure they also agree on the need to combat loneliness. Just to give you a few numbers on the Norwegian NGO sector, it's around 100,000 NGOs in Norway, and we are 5 million people, but we have 10 million memberships in NGOs. And it should tell you something about how the Norwegian society is structured. Like most Nordic countries, a lot of our leisure time is spent in NGOs. A lot of the things that we do is done in the NGOs. And that means people that don't participate in the NGOs, they are left outside things. And it's important to make sure that that participation is open to everyone. And I want to spend a few minutes on that. This is my son. He is older now, but this is at his start of his dreaming about becoming a big football star, which he hasn't become yet. But there are two main things lacking here, of course. He's in the biggest football field in Norway, but there are no team here, and there are no spectators here. There's no one cheering for him here. And that's what the NGOs often provide for people. It's a team and someone to cheer you on as you move through life. And the participation in the NGOs in Norway is very much participation in the society. And that's why the NGOs need to be inclusive, open to everyone, and also open to people independent of their social and economical background. I used to be in the board of children's football in Vålerenga Football, which is the largest football club in Norway. And we used to say that we are the most important inclusion actor in Norway, because playing football in our club together with other people, this is how you are included in society. But there are many things, many barriers for participation. And in Frivillighet Norge, we've done a lot of research. We've spoken to many NGOs, and we've identified 6 of these. One is economy, of course, that that you can't afford participating for various reasons. We've talked a lot about that today. It is very crucial to children and youth, but also to grown-ups and seniors, and more so, as things are getting more expensive these days. And it's important to remember this. And also, I don't really see it. Knowledge is a very big barrier to know about things that are happening, to know where you can participate. And we have done some projects on that. Time is another one, that people are busy these days, and we need to if we want them to participate in the NGOs, we need to make sure that they know how much time is expected from them in their participation. Another one is culture. Of course, as we are getting a more diverse society, we need to make sure that culture is not hindering your participation, and that you understand how to participate and why. Accessibility is another one. Your ability to move in society shouldn't prevent you from participating. And also the support and follow-up, which is something I care about a lot. That if you take part in an NGO, then you should be supported. You should be welcomed, and someone should take care of you. This is one of the answers that we have developed. It's a digital platform, or 2 digital platforms. The first one was frivillig.no, which is voluntary.no, I guess. And it is a platform where everyone all NGOs and other leisure activities can put on assignments. They can tell you what is happening. They can tell you where they need people. And you, as a single person, you can go in there and see where you can participate. And we've developed a similar platform only for young activities, or activities for young people. And how do we combat loneliness? For me, I think the most important part, and I think for everyone, is participating in the regular activity. When I was in a football club, I remember we were always offered money for arranging various projects or various activities that were only for a day or so, and only for groups that we already discovered as not taking part for some reason. While we knew as a football club that what would be most effective is for people to play regularly in that club, to play football regularly with other people. And the regular activities is what combats loneliness the most. So for us, it's important, and for me it's important to say that if you want to support the NGOs, don't support projects, support the regular activities. What lowers the economical threshold for participation? It's if the NGOs have enough core funding to offer activities for a lower price. And what makes people less lonely is if they meet people who are interested in the same as them and do things that they want to do. People don't want to take part in an activity that is combating loneliness. They want to take part in an activity that is about helping the environment, or protesting Israel or Palestine, or being a part of a tour group, or arranging pride festivals. That's what makes them less lonely. That's how they can contribute to society. And our study also shows that the main reason why people want to take part in NGOs is because they want to have fun and they want to do something meaningful. So offer them that and they will be happy. And this is a little model that we made, and it shows the value of NGOs. One thing is, you see the activities in the middle there, and they have an intrinsic value, as I called it, the internal value for the people who participate. It's doing what they want, what's fun, what's meaningful. But then they also have a big value, an added value, and that is that they solve certain tasks, but also indirectly that they foster democratic participation, they build knowledge on things, they build social networks, they build trust in society. And these ones cannot be ordered by politicians. These ones cannot be paid for in direct value. These ones cannot be decided that we want. They just happen. But they are the most important value, I think. And it's sometimes hard to measure it, but it doesn't mean that it's not meaningful. And I think we've heard some examples of that this today. So just to sum that up, how do NGOs combat loneliness? Through regular activities, through targeted efforts, by filling in the blanks that governments don't support or don't provide, but also by joint efforts through networks that between NGOs. We have a Nordic network now that's about combating loneliness, because we see that the Nordic countries are quite similar, so we try to learn from each other, which is a good thing. And NGOs work very much with prevention rather than treatment. And that's also something to remember, that the treatment part is more a public responsibility than the NGOs. And how can governments promote these values? Through being sure that we have a distribution of roles, that some tasks are for the NGOs and some tasks are public responsibility, and we should be aware of that. And I also think the government should leave the volunteers alone. Some local administrations are very happy to get the volunteers for themselves. I think that's that could be good in the beginning, but it can also be hard when we move on, because then they don't feel any connection or responsibility. So it's only using one person for a while, and then this person disappears, and it's not connected to anyone. So instead, working with the NGOs instead of using volunteers directly. And I also think it's important that the NGOs support, now that the government supports the NGOs by stable funding, by ensuring less bureaucracy, and that's especially important when we talk about the leisure cards, I think, that we have talked about today. And I also want to add on that it's important to safeguard the space for the NGOs. We've seen now in Norway a pretty bad example of the opposite when it came to the Pride Festival that were attacked a couple of years ago. And actually the report now, it concludes that the Norwegian government did not, they actually broke the human rights. They were not able to safeguard the protests that were followed by these attacks. And that's something we need to make sure that we do in the future. So, just this is my son again. He found a team. They went to Barcelona. They won a gold medal in the end, but I think that's not what was important to me as a mother, that he did that. What's important for me is that he found friends, and he found something that made him feel meaningful and that made him have fun in his leisure time. And that, I think, is the main result of the NGOs' work. Thank you.
Thank you very much, Guri, for also pointing out the important role of NGOs in tackling and preventing, not least, loneliness and social isolation. We'll continue the conversation up here in a little second, but first I would like to just share with you one last film with some young voices on social isolation and loneliness. It's right here. Kom gärna upp.
Ja, om någon verkar ensam så skulle man ju kunna vara med dem mer och säga att man finns där för dem, och att om de behöver hjälp så kan man prata med dem. Och så.
Om någon känner sig lite ensam eller lite smått utfryst så får man ju försöka typ inkludera dem eller prata med dem så de kan känna sig med liksom.
Jag tycker man ska bjuda med den och visa att man finns där som en riktig kompis liksom.
Sätta sig och prata med den personen. Du behöver kanske inte bjuda in till den personen till någon fest eller... Och sen också, om man börjar prata med dem mer kan man ju bjuda hem personen, beroende på hur bekväm du är.
Skolan har ju också ett ansvar att få liksom, personen och att delta på ett sätt och att liksom, få personen att sluta vara ensam. Liksom. Man kan till exempel om man ser kan man informera de andra eleverna att kanske tipsa om att häng med han lite till, kanske ni är ensam just nu ser det ut som.
Skolan borde främst informera de här, alla så att alla förstår att man måste bjuda in alla så att det blir naturligt. Liksom.
Jag tycker att läraren ska gå fram till barnet och prata och säga till de andra att vara med hon eller han. Om det skulle vara en tränare så skulle jag sätta i typ så här, en liten grupp så att den kan känna sig mer säker. Prata hjälper mycket.
Thank you for that. And now I've been joined here again by Hillevi, by Guri, and by Margaret again from Planet Youth in Iceland. Thank you very much, Margaret, for also joining us in this conversation on the prevention of loneliness and social isolation in the Nordics. And just to be clear, the focus of this conversation is not only on the children and youth, but definitely also on the broader view of the Nordic population. And first, just to get us started, let's just spend a minute understanding the issue better. I've seen research into social relationships and mortality risks that has shown that severe loneliness has the same negative influence on health as alcohol abuse or smoking 15 cigarettes a day. But my picture is that loneliness and social isolations is still being overlooked as a significant threat to public health. We spend less focus on that and more focus on many other things. But do you agree with me that we overlook the risk of loneliness and social isolations, Margaret?
I totally agree, and this is kind of a new topic. I loved listening to my colleague here today, and this is what we are dealing with, both regarding children, adolescents, and then grown-up. But at least we now know we have all kinds of data, so we can start to build our action and look into preventive work, like you mentioned.
Guri, Hillevi, do you agree that the topic of social isolation and loneliness that is being overlooked, Guri?
Yes, and I think what's important that Hillevi said before is that there are different kinds of loneliness, and I think we tend to focus on the ones that don't have any friends or the ones that are sitting home alone because for various reasons. But many people are very lonely among many people. And I think that's something that the NGOs should work on, because if you come to an organization because you want to contribute and then no one sees you or no one uses your abilities or you are left alone there, then I think that is even more dangerous than sitting at home and watching Netflix, because then at least you're doing something that feels meaningful for you.
And that's obviously true that we need to look into this in a more differentiated way. I think the research that shows that it's involuntary loneliness, just to say that of course some people have less social needs than others, but it's the feeling of being alone. It's not an objective size. You can be surrounded by many people and still feel very, very isolated.
And many are now because of social media. We are surrounded by people all the time, but it doesn't mean that we don't feel lonely.
No, and that was the next thing that I wanted to touch upon. Hillevi, you were introducing a bit of the risk factors and some of the things that are happening in our societies. And I'm just curious to learn a little bit more about these things. What is it in our societies that creates this high prevalence of social isolation and loneliness?
It might be different things. Actually, it can be everything from normal life transitions. If we talk about children and adolescents, for instance, you go through a lot of changes because maybe you finishing school, for instance, maybe you move to you start a new job or go in higher education or something, and you leave the friends and your family behind, and you find yourself alone. And that's just a natural transition that everyone's go through, more or less, and you feel alone, and they might be also a starting point for longer loneliness.
But I'm curious, now that you've looked into a lot of data on these issues, is there any, finishing school, that's always been a transition. Everybody has been finishing school at some point in their life. That's only natural. Is there something in the research that you've seen and the data that you've looked into that explains why this is a growing trend when it's basically also natural transitions and natural emotions that occurs in our lives?
Yes, we can see common risk factors, and we think they're common both for adolescents, young people, and older adults. And for instance, which we have been talking about a lot today, is disabilities and health problems. And it's also interesting that the research shows that it's often not the disability itself that creates loneliness, but rather it's the society, how you if you get support, if you get understanding, accessibility, so you can go to social activities and the like.
Guri, you mentioned the screen. None of you really mentioned it before, but I mean, we've heard already today what an issue screen is. I guess in this way, it can be a two-sided sword. It can both be an ability to be introduced to different online societal or networks, but then it can also be a threat that you're there alone. What's your view on the impact of screen use for social isolation and loneliness?
Well, I think it's super hard because it's super hard as a mother as well to know how to regulate it, and also for myself personally. But I think it's important for the NGOs. It's important to move people from the screen and into their activities, and that they can add on the networks and use the screens and moving people from there and out in the real world, as we say.
Margaret, you come from a research company. You have tons of data. You explained that to us earlier today, which for many years have studied also these things. What can you see in some of the data that you have that explains, or some of the risk factors that explains social isolation and loneliness, especially within children and youth?
Okay, when looking at the data we have, we see that older adolescents compared to younger children, we see girls more than boys. We see bigender more than non-binary more than boys and girls. That's clear. Poverty, lack of resources, and I think there is no coincidence that we are talking about leisure activities and screen time joined with loneliness here today, because we also see that those who are not participating in organized activity, they are more likely to experience loneliness. Those who feel like missing out. But we should also keep in mind that maybe it's too much screen time when it comes to our youth, and lack of technology, knowledge of technology when we grow older. And I think that this fear of missing out, that not being part of what's going on, this peer pressure, we have youth that is constantly online, both to be criticized and also to share their life. So I think that this is something that we should take into account.
Do you see other risk factors in your data that is important to bear in mind?
Mainly those in screen time. When we look at mental health in our data, loneliness is part of it. Too much screen time, more loneliness, lack of sleep, lack of good mental health. So it's so connected. Everything is connected together. And what I think and what I've been learning really here today is we have to connect all those points, the dots we've been talking about here today. And we have to stop that we are the slaves of the technology. Technology is something that we create, you know. And so we should be the ones who are in charge of or in control of it, you know, regarding screen time. And also how important it is when it comes to, you know, mental health issues for our youth is how are we supporting the parents and the caregivers? How are we informing them about the role of the NGOs, about the role of the leisure activities, about how harmful it can be if our children are spending too much time on screen?
Yes, please.
Yes, and also, of course, a lot. There's also the digital outsiderness. You have seniors that don't cope with the digital services so much. You have people living on the street that don't even have a phone. You have people that, for other reasons, don't participate in these online networks. And it's a very important task to make sure how to that you can reach them. Which we saw very clearly during the pandemic, for instance.
I'd like to move on to preventive strategies and interventions. You said that clearly agree that the NGO sector, that's on the preventive side. And that's also basically the question, I guess, that you've also been tasked with, Hillary, from the Swedish Minister for Health and Social Affairs. What role can society also play in combating loneliness, in reducing the prevalence? What do you see, what kind of preventive measures or strategies or initiatives do you see as particularly valuable and effectful in reducing loneliness? Hillary?
Well, it's a good question. From a research perspective, we are doing reviews right now to see what interventions are effective and the like, but we also have all those initiatives in Sweden going on different places. So we can see that maybe social activities and meeting places are good for preventive purposes, like you said, but also this problem that not all are participating. One aspect that is important, I think, because the church and religious organizations are often good at helping people who are marginalized and the like. And one thing is about offering practical help in some way. They can offer a meal, they can offer help with authorities and the like. And when you gather around a practical problem, it may often be a solution to start more deep conversations and solve social problem as well.
You had on your slide, you had the different elements of the different sectors and which role they could play in together combating loneliness. And I know that the strategy is not finished yet, and all these things. But still, what is your view? Are you looking for like specific interventions that you believe can do a difference, or is it, as Margaret said, is it the holistic approach, the many different factors? What are your thoughts and views at the moment on what will have an effect?
I think the impact is that different actors at different levels of society works together in a holistic way, because all agents have a different mandate to work on this issue, so they all can contribute in a unique way, and that is what we need.
Margaret, I would like to go back to some of the risk factors and the vulnerable populations. You mentioned several. You said girls more than boys, people in less fortunate economic situations. You also said people who identify as non-binary and all these things. I'm curious to learn, what are your thoughts on how can we address and how can we help specific groups that we know are in a bigger risk of social isolation or loneliness? What are your thoughts on what do we do? A holistic approach, yes, but how do we target things also to the groups that we know need it the most?
There is no magic pill. There is no quick fix. But I would always go, just look at all the knowledge that we've been talking about here today, been shared here today. The most important thing is that we bring this out to the community, for the general public. This is not common sense for everyone. So, for example, we have parents raising their children today that are I know, younger than me, but not that much younger, talking to young generation that has all kinds of new words about feelings that were not even existing when I was growing up. So we have to educate and inform and train parents how we can help them. Because for me, when I look, and for us at working within the Icelandic prevention model, is all about bringing the outcome, using the local data, inform and take action in close community. So it has to be like that. That we know that at least we know a lot what is causing both loneliness, too much screen time, lack of mental well-being, not participating. So when you add this kind of information to what we are already telling the parents about, because they are actually now asking for it. They want assistance. They need assistance regarding both, you know, mental well-being of the children and participation. Yeah.
Guri, you mentioned the fact that in many volunteer associations, you are being offered like money or resources to do specific initiatives or specific resources that target specific groups that are in need or seen to be in need, whereas you say, well, what really helps is to bring them in to the regular activities, which might be harder to get funding for. What are your thoughts on like how can we best help these risk groups? They might be, as Margaret identified them, or they might be different. But what are your views on what can we do best to help those groups in our society that are in a bigger risk of social isolation and loneliness than others?
Yeah, I think it's important to be able to reach them first and foremost. That to be able to tell them that you're welcome in this or that activity, and sometimes partnering up with, for instance, now we are having a partnership with school nurses that help vulnerable kids reaching activities. This is something we can do, and that the public, like local governments, can help people reach activities and know where they are. And I also think I saw an interesting number now showing that the ones that are the least members in NGOs and participants in activities are parents of young children, because they are so occupied with other things. And that's in one way okay, because they are included in society in other ways. The problem is that they don't necessarily move on to participating afterwards when they don't have young children anymore, and that can make them very lonely, because then suddenly they don't have kids staying at home anymore. They maybe they lost some of their social networks that they used to have when they had kids, and they move on, and then they become seniors, and they don't have this network that some people have, because they have been participating in regular activities like choirs or football groups or whatever their whole lives. So I think it's very important to reach out also to people that are not seen as target group now, but can become one. And that's also something.
Another question, I think first for you, Guri, and then I'll ask the same question to you, Margaret, because you mentioned, Guri, that that sports organizations or volunteer organizations can be the arena for inclusion. Then I can say as a parent, and I think a lot of parents could agree, that football clubs, for instance, they can be very inclusive. They can also be very exclusive, and that's part of the thing. Like we have our team, they have their team. We want to fight them. We want to win. This is us. We have blue shirts. They have red shirts, and I mean, so it's very visible who are in and who are out. How do you work with voluntary organizations to make sure that they are in fact inclusive, and that they are not, which they could be or can be in some regards, also exclusive?
Yeah, I think this is a task that the NGOs in all kinds of leisure activities should have all the time. And of course, it's harder in kind of activities where you are in some way measured by your abilities, which is hard, and they need to have a continued focus on it, and they do have it, but they can be better at it. And I also think core funding, so that they are able to work on it, is important, and trusting that they will do it if they have the time and resources. And now, just to add on that, I know that there are about 70,000 refugees from Ukraine now in Norway, for instance, and it's important to reach out to them. And an issue with them is that they don't want to be integrated in the Norwegian society because they want to go home. What they want the most in their lives is to go home again to a peaceful Ukraine. But it's not peaceful now, and they can stay here for a couple of years or so. And the kids of those people should also be included. So I think also when it comes to inclusion, it's important to have a sort of temporary position for people, a temporary inclusion, not thinking about everyone that they should be there for many years, but for a year or so. And that's okay.
Margaret, you work with voluntary organizations as well as authorities in many different countries. What are your general advice as to how to help voluntary organizations be inclusive instead of being exclusive?
I think it's the most important thing is to be aware of your role, how big a role model you are, how important you are. And that's also what I was talking about earlier here today when I mentioned the leisure card, that we have to educate and train our coaches and trainers and teachers about their important role. And we have it also, I think I forgot to mention that, we see that people coming from abroad, new Icelanders in Iceland, they are also experiencing more loneliness compared to others. So there is always this sense of belonging, being part of. You know, when I was growing up, the slogan was that technology was connecting people. Maybe not totally true, maybe disconnecting, but now we have to make sure that we are using the magic of the society, magic of, you know, spending time together.
The last thing I want to touch upon is policy and governance. Now, Ylvi, you've been tasked with, or the Swedish government has tasked the Public Health Agency and others to do a national strategy. But more generally, I'm curious to hear your perspectives on how policymakers, government agencies, what role they can play in actually addressing loneliness and social isolation as a public health hazard. What is the role that government, public authorities, agencies can do?
I think they can do a lot of things. Actually, like I said before, just legitimate the question. Working with this issue, as you said, it has been a long problem, but maybe after COVID-19 we started to recognize loneliness. So that's the first part. And the agencies have different roles. Some are working on healthcare and social services, and they can contribute very much since we see this relationship between loneliness and health. But also agencies working with how we organize and plan our society is also very important, actually, to have increase inclusion and loneliness, so everyone can join activities and be safe.
But I hear you also raising the awareness question, the fact that social isolation and loneliness is actually a public health hazard. Yes. Other views or perhaps perspective on what government agencies, authorities can do, Margaret?
I think it's really important to listen to our youth. What I understood from the video played before, they are actually asking us for professionals within the school. They want safe spaces. We need to listen to them because they are dealing with all kinds of new issues that we have no clue what it's all about. You know, it was not there when I was growing up. So listen to them and make sure that they have opportunity to reach out to grown-up people if they need, especially when it comes to their mental health. And that then would need the support for the government and people with power and money.
And also in Norway we have a success with local municipalities developing local strategies for cooperation between the municipality and the NGOs, and how to support the NGOs locally. And that's I think it's boring, but it's what works. So I think that's also important to remember, that as long as you have a strategy, you want to support the NGOs, you want to support their activities because you believe they matter, then you will have good partnerships in the future. And we also saw that during COVID, that the ones that had this strategy in place, they developed a better system for handling it immediately.
We can deal with things that are boring as long as they work. Thank you very much, all of you, Margaret, Guri and Hillevi, for joining me here and addressing this issue as well. So thank you very much. Now, as I send you off the stage, we are about to round up this conference, and time is going fast when you're having fun. So it's beginning to be time to draw out the curtains on this conference on good and equal health in the Nordics. And first and foremost, I want to thank each and every one of you for participation and contributing today, both here on screen, but also out there, as well as for your continued work on matters that are important for the population in the Nordics. And I would like to encourage you very much to take what we've learned here today and put it into action back home. Now, to help me round up this conference, I would like to just briefly invite one of the organizers of today's conference, Sarah Holtzbrink, representing the Swedish Presidency of the Nordic Council of Ministers, to join me here on stage. And I have questions for you just in a second, Sarah. But before I ask Sarah on her reflections on today's conference, I would like to invite the rest of you to share some of your views on today's conference. So please take out your phone or another device connected to the internet, go to menti.com and use the code here on the screen. Once again, you can also use the camera on your phone to scan the QR code and then share with us your key takeaways on today's conference. We're very happy to take that with us. And while you answer this question, I'll pose some questions to you as well, Sarah. First, what are your main takeaways from today's conference?
There's been a lot of interesting topics today, but I just want to also to start to say thank you to all the great speakers and the panelists that we heard today. It's been very interesting, very inspiring listening to. And I think one thing that I really can take back home is that there is already a lot of knowledge, and there's a lot of activities already taking place in the Nordic region that are addressing these themes that we've been talking about today. So that's very inspiring also for the future, and to hear that there is already collaboration ongoing that we can learn from.
Also, based on today's input, I know that you will have to answer back to both the social and health department, but also to the minister Jakob Forssmed, who asked us some questions this morning that he was very interested in, to get our inputs on. What are the questions or the inputs that you will bring back to the minister and the Swedish government?
Yeah, just mention a few things in particular that I will take back. I think, like what we heard already from the WHO this morning, and those principles that Katrin presented. I think we can learn a lot from them, like in an overall public health context, and bringing them with us in like engaging with target group, listening and involving children and youth when designing interventions, and also what she said about changing norms and the importance of public support in policy making. I thought that was very thoughtful. And also, of course, interesting examples from both Finland and Denmark about leisure activities. And also, again, the importance of involving children and youth in activities that actually involves them. And I also, it was from the Roskilde example, I think, about the social partnerships, that it's not only a matter of financial support, but then also that follow up with I mean, how to support children youth also access the activities.
It seems, now that you also mentioned it, it seems like there's been answers to some questions that has definitely been relevant for other questions as well.
Definitely.
That there's definitely an interconnectedness between those themes, and some of the solutions for one topic might very well be relevant for others as well.
Definitely, it's very interlinked, and I think if you find a solution to one of these, it will probably give like rings on the water to also other topics as well.
We're also getting in different conference takeaways. I don't know if we can put it out on the screen so that everybody else sees them as well. But there are many good thoughts on both digital media, loneliness, and the sharings across the Nordics. Any last comments, questions, reflections that we should take with us, Sarah?
I mean, just to mention something on the digital media, I think what we can summarize there is it's a complex matter, as we also heard today, and to find the balance, I think it's important, and we'll bring that back. But also that there is maybe a consensus about the need for regulations, and that we can learn from the different examples that were presented. But now I think also we need to summarize like all the results from today and from all these valuable Nordic experiences and bring them back. And it's been such a great opportunity today to gather all this knowledge and insights on both the challenges but also on the solutions. And it will probably help us moving forward in a public health effort. I mean, both on a national level, but also in the Nordic context.
Thank you very much, Sarah, both for your reflections on today's conference, but also for, together with the team at the Nordic Welfare Centre, Helena, Nadja, Victor, and Anna, to organize this event and bringing everybody together. Last, I would just like to inform you that in a short while, you'll receive an email after the conference with a short conference report that are summarizing some of all the inputs and the presentations that we've had here today, as well as relevant links and other materials, so that many of the things shared today will be spread. Also, you will receive a link for the recording of today's conference, so that it can also be reviewed or shared to others, either in full or at least the different parts that might be relevant for your work. But that's enough for me. Let's keep the conversation going, keep sharing insights and ideas across the Nordic region, as you say, Sarah, and keep making the Nordic region the best it can be. Thank you very much.